Welcome everybody to the first day of December Tuesday meeting for the Lane County Board of Commissioners. We are going to start a pretty full day today, and we will go into tomorrow on items regarding redistricting work session on that. So today, the only initial announcement is that we do have an executive session in the afternoon when we get done with our regular agenda for the most part. So we'll launch right into it. Any adjustments to the agenda today? No adjustments? Okay. Any emergency business? No emergency business. So we'll go straight to public comment. I didn't read the full script that I normally do this morning, so I will paraphrase for those that are watching. If you're watching now and you want to speak during public comment, you have a moment to raise your virtual hand. You'll be given 3 minutes for public comment. In the case that we have too many folks for the time allotted, we may need to reduce the number of minutes per person, reduce the amount of people speaking and pick, but we haven't had any of those issues today. Otherwise, you can just watch and we will continue to move forward. So right now we'll move over to the moderator to facilitate any public comments.
Thank you, Chair Buck. At this time, if you have signed up for public comment, please make sure you have raised your virtual hand. Please only press the button once because it is a toggle, so every time you press it, it goes up and down. So I will call upon anyone who has their hand raised. My first presenter will be Chris McCallister, and I will follow Chris with Heather Selecky. Mr. McCallister, I will unmute you and begin your timer, and you may start your public comment. Do you show you are self-muted, Mr. McCallister?
Thank you, Diane. Good morning, commissioners. My name is Chris McCallister, and I come from Springfield. I come before you as a volunteer organizer for Egan Warming Centers in Springfield, a first responder to our unhoused needs in Lane County, and as a community member who has been serving our people in these wintry times since I can remember. That said, I hold this space in the name of Tom Campbell, who passed away last year, 10 days from now, and weather that was 5 degrees warmer than what we have right now. We need help this year more than ever. We need access as first responders to COVID tests in a timely manner. We are having to do this work without options, without knowledge. And for the first time in our team, we have a positive COVID test. Not someone who has been by our people in 14 days. However, the threat is real, and we do not have options that will give us results within 10 days. We are working with other groups who also are having outbreaks that we are finding out about weeks later after we've been serving needs where people have no longer been able to get services, but we were not told as providers that this is happening. And so I fear with over 600 people contagious in this county that it's going to get worse before it gets better. Springfield has been without an Egan site for a while, and we have a potential space that can help 10 to 14 people. We have no options outside of asking for further help. We need something to change, and we need something to change quickly. I'm not asking for y'all to open up all of your properties. I'm asking for resources and coordination to support those who will do the work. Those who will do the work tirelessly for the people to preserve the lives. We have over 26 people who have passed away in the last year. We have people who are needing support, but right now there is no clear place. If there is a COVID positive or a symptomatic person, I'm supposed to turn them away. I'm supposed to tell them to go to the hospital on their own, to take public transit, to do all the things that we are warned not to do. But there is no answer. There is no option other than please wait, we're working on it. So please help us help people, help us carve spaces. Let us find places for people to shelter in place. Let us find a way to send people who are symptomatic to where they are not told, assume that everybody has COVID and just be careful, because that's how people die. I need to know that our people are all together, and Springfield has risen to help people, but we're running out of options. The hotel rooms will not take our people anymore because we cannot clarify or guarantee that they do not have COVID. We will have more deaths if we don't do something different today. Please help us. Thank you for your service. Thank you for your efforts. And we are all in this together. Springfield's rising. Lane County is rising. We need more. Sorry for going over.
Thank you for your public comment, Mr. McCallister. Our next presenter is Heather Selecky. Heather, I will unmute you and start the timer, and you may begin your public comment.
Good morning, Commissioners. My name is Heather Selecky, and I'm a resident of Lane County dedicated to its improvement. My areas of focus are homelessness and emergency systems response, and I'm here today to testify to an urgent need for greater coordination in both areas. We stand at a moment in time where the realities on the ground must inform our strategies. Despite our best efforts, thousands of residents of Lane County lack real alternatives to living outside, access to hygiene and sanitation facilities, and adequate protection from the environment. It is for those who most need sanctuary I come before you today to request that the Lane County Event Center parking lot temporarily be used to fill this critical need. The space is large enough to accommodate multiple managed pods of non-congregate shelter communities. With adequate sanitation and nighttime security to protect the rights of all community members and neighborhoods, we could provide safety and stability to disaster-impacted people to allow them to recover. The pallet shelters and storage could be deployed immediately, and disaster relief tents could be produced to meet the scope and scale of our community response. A portion of the property could be designated where sheltering in place in one's own accommodations, including sheltering in a vehicle, is allowed. These short-term policy changes will minimize the risk of spreading COVID-19 until additional temporary sheltering locations have been established and alleviate suffering. I urge you to work with the Lane County Fair Board, who you will be meeting with jointly this month, to take action in this unprecedented time. We must ensure refuge is provided for the ones who need it most. Our whole community depends on it. Thank you.
Thank you for your public comment. Our next presenter is Bruce Moore. Bruce, I will unmute you and start your timer, and you may begin your public comment.
Thank you. Good morning. I'm Bruce Moore. I'm the attorney for Vern Benson and Five Doves. I'm here to speak on the matter of authorizing the sale of tax foreclosed properties to Vern Benson and Five Doves. I put together the presentation, which is in your packet. The authority for the sale back to Mr. Benson is contained in Lane Manual Section 21425 sub 4. Mr. Benson would qualify under two of those items, one of which is for purposes of my presentation this morning, a bit more important. The first allowed exemption is if the sale is being requested back to the property owner, and we've got the title documents have been submitted to you by your staff and by us showing that that existed. More importantly, we've presented evidence that Mr. Benson, the record owner or contract purchaser of record, suffered from a mental or physical incapacity or inability during the foreclosure and redemption period. And I believe we've submitted satisfactory evidence to you. In our packet, you will see that Mr. Benson is a 72-year-old who suffered through a debilitating health year in 2020. In early 2020, he developed severe coronary artery disease and nearly died. We've presented you with a very thorough letter submitted by his treating physician, Dr. Rob Dramov, who has given the diagnosis and the applicable dates, and giving the explanation as to why the very serious nature of the health issues were debilitating and incapacitating. The time period was from March of 2020 through October of 2020. Mr. Benson underwent 5 surgeries this year, not as an excuse, and obviously this is, a situation where Obviously, the property had already been foreclosed on, and we're talking about a redemption period. Mr. Benson believed that the time for redeeming the properties would run in September of 2021. He does not deny that the county sent a reminder, but that reminder happened during the time period of the most significant disability during the September 2020 time period, which you can see in the doctor's report. He was in the midst of several surgeries at that time and had been ordered, to not work. We ask you to consider the financial impact that COVID had on him. He'll be one of the speakers to explain what it did to his revenues this year and the significant health issues. He has the money available right now to do this. I respectfully request that the Board of Commissioners enter an order authorizing the sale of the 3 parcels back to Mr. Benson. And I thank you for your time.
Thank you for your public comment. At this time, I do not show any more hands raised. If I have missed you and you would like to speak at public comment, please raise your hand. Teresa Colcord, I do show your hand going up and down. I will unmute you, and if you would like to give public comment, I will call upon you. I'm unmuting you, and it looks like you're self-muted. If you'd like to give public comment, you can unmute and begin your public comment.
Hi, my name is Teresa Cope, and I'm a resident of Lane County. I have lived in Lane County since 2002, and I have been a volunteer for Egan Warming Shelters about 6 years. The last 2 years, I have been the site lead, or one of the site leads for our Egan Warming Shelters in Springfield, which have had various locations. This upcoming cold spell today, this afternoon and evening, is the first time that Egan will be able to operate in Springfield at a very small site that has been graciously loaned to us by a local faith business. My understanding was at the beginning of the Egan season that we would have trained personnel who would be conducting screening and would be determining if people were at high risk for COVID, had been tested for COVID, but were waiting for a test result, or if they were actually symptomatic for COVID. And that then those medical professionals could divert them to the proper place. My understanding was River Avenue was one place during the original emergency. Another place was Wheeler Pavilion. Today, I come before you to tell you that's not the case. St. Vincent de Paul and everyone I have spoken to says that we are to check for symptoms, and then it is up to us to make a decision based on a list of their symptoms in the last 48 hours. So me, as a non-medical professional, as a volunteer, as a member of our community, to decide one of 2 really bad options. Option number 1 is to admit them, potentially actively symptomatic, sleeping, probably without a mask, because that is not recommended to sleep with a mask, potentially infecting everyone else that is on the site, volunteers, church workers, as well as other residents. My only other option is to tell the person who is presenting as symptomatic or as exposed or as waiting for a test result to tell them they need to leave, that they are not welcome at Egan, and this is their problem to solve, that they need to figure out where they can go. They could go to the hospital if they like, but they have to make their own way, and there's nothing more we can do for them. I find this as a volunteer very unsettling. Egan is an important part of our infrastructure for helping our less fortunate, unhoused neighbors. We must do better than this for them, and we need to do it today. I very sincerely hope that proper health authorities will be in touch with St. Vincent de Paul today to make better decisions and better choices available to me as a volunteer. Thank you for your time.
Thank you for your public comment. At this time, I believe we have concluded our public comments. I will give everyone one more chance if you have not been able to present and you still would like to raise your hand now.
Hi, this is Bruce Moore. I have Vern Benson here in my office, and we had him on the list.
I'm sorry, who do you have on the list?
Vern Benson, I put him on the list for public comment. He's here at my same office. So when you get my second hand raised here, it's so that he could comment.
Okay, yeah, I do not see him logged on, but if he would like to begin his public comment right now, that would be fine.
I'll hand him the microphone. Thank you. And you're available.
Good morning. My name is Vern Benson. I'm 72 years old. I'm the owner of the property, the three pieces of property you guys foreclosed on for back taxes. I'm requesting the county to sell me back the property because of my medical conditions. In March of 20, my medical problems started then. And between August the 1st and October the 1st, I had 5 major surgeries. And because of COVID, I couldn't go in the office. I didn't realize the deadline date on the foreclosure was September of 20. I thought it was September of 21. And I had no clue that the deadline date was there. And so because of COVID, I couldn't spend much time in the office. I had the funds available to pay the taxes, and I have to borrow the money from my son to do it because of COVID, my office is down, and me being out of the office, my office is down over $300,000 this year. So again, I didn't realize the deadline date because it's in and out of the office. But I can't get a hold of the money and pay the taxes as soon as the taxes are due. And I have to borrow the money from my son. So thank you much for your time. I appreciate your help. Thank you.
Thank you for your public comment. Chair Buck, at this time, I believe we have concluded public comment, and I will turn the meeting back over to you.
Thank you. We'll move on to Commissioner's response and remonstrance. Would anybody like to say something? Commissioner Farr. Commissioner Farr, we need your audio.
Thank you. Thank you, Chair Buck, and good morning. First time I've had a chance to say that to you today. I'm going to respond briefly to Mr. McCallister and Ms. Selecky regarding sites for Egan specifically. We've been working on getting sites throughout the county. And as you know, Bethel School District has authorized, the administration, as supported by the board, has authorized use of Bethel buildings, Bethel School District buildings, which haven't been used yet. It seems that there's been some difficulty, as you know, in attaining enough volunteers to man or to staff the sites that are being offered at this point in time. So we'll work forward on that. And then, Mr. McCallister, I talked to you briefly about the potential of other school districts, and I'm not sure where we are in that process. So I'm hoping and expecting that we'll move forward as volunteers become available to have more sites available, spaced geographically where people can access them. Bethel buildings are a little bit more difficult for people to access because of the remote nature. Many of them are clustered out on the west end of town, and one of them even outside of the city limits. So we'll continue to move forward on that. Regarding Teresa Covert, and I'm sorry if I pronounced your last name wrong, regarding training for volunteers, my understanding is that St. Vincent de Paul is handling the training, and I'm not positive exactly what the contract is or what the nature of their training is, other than they have been actively seeking training and actively providing training venues for people. So we're moving forward as quickly as we possibly can on that, as far as I can see. But it certainly requires a little bit of monitoring right now. Mr. McCallister, while you are here, I'd like to congratulate you on recently being elected to be the chair of Lane County's Poverty and Homelessness Board. Congratulations on that. And also for your candidacy for the chair to replace me as a shelter, the Shelter Stakeholder Committee, which was formerly the Veterans 365 Committee. Congratulations on your stepping down also to allow Kristen London, who is from Looking Glass, to be the incoming chair of that committee. That committee has a great deal of work as a multi-jurisdictional committee, as you know, that has a great deal of impact, and your work there is highly regarded and highly needed. Selecky, you've also attended that committee meeting a number of times. So that committee is a good place to forward some of the policy requests. As we move forward with Egan, perhaps Mr. Mokrahajski can talk later about Lane County sites. We have been opening Lane County sites, not always successfully attaining enough volunteers to staff them, I understand. So maybe Mr. Mokrahajski, after other commissioners have spoken, can talk a little bit about what we're doing on Lane County sites, in addition to the parking that we are allowing on Lane County property at this current time. Thank you, Chair Buck.
Commissioner Sorensen.
Thanks very much. I just want to thank everyone who has given public comment this morning. I think it's an important part of our meeting. I'm glad we do it close as possible to the beginning of the meeting. I just want to zero in on Ms. Selecky, and in a very specific way, she's asked the county to open its arms further to the problems of the homeless in our community. And I think she's made a really excellent suggestion that the Lane Event Center parking lot be used, and specifically for the kinds of uses that I think would be compatible with that space, and I'll call it a desperate need to address the joint issue of poor people disproportionately getting the COVID virus, and the need for non-congregate setting shelter for the homeless during the very brutal weather that we are having, and will likely have more of. So I personally would like to see at some point later in this meeting, either during the administrator's announcements or, as Commissioner Farr alluded to, maybe even now, and certainly at the point where the board decides whether we're going to move forward on a particular idea in the form of a report request of the administration, or the board having its own work session. I'd like to really see if this agenda topic can be advanced. And I think it is good that we do have a number of committees, including the Poverty and Homelessness, Public Health Advisory Committee, the Interagency Human Services Commission, all of these different programs that we help to fund and oversee have a role in this. But ultimately, the use of county property and something that would be big, like the use of the fairgrounds property, is going to have to, the leadership's going to have to be here at the board. So that would be my request later in the meeting. Thank you very much.
Commissioner Bernie.
This topic is overwhelming to me. It is inconceivable, the pain and the suffering that's going on right now with our neighbors. And the dissonance between what we as one of multiple governing bodies are able to do with the resources we have and the time frame needed is just really frustrating. I am all for Heather's and what Chris stated. I mean, there's so many issues here. One issue is COVID testing. It's my understanding, and I'll be asking this of our health professionals later, that many countries and parts of this country are now using a saliva test that is returnable in a day to get results. Some schools are paying $15 per young person per week to get such a test every day. So if that technology exists, it'll be interesting for me to hear where we are on a path towards perhaps acquiring that. The whole issue of that Heather brought up, I mean, I agree, reality on the ground does have to inform whatever we do. And whatever we do is dealing with crumbs as it relates to the resources needed. My understanding, and Chair Buck, perhaps you could tell me I'm wrong or right when you speak, but my understanding is you are developing with the Eugene 4J School District some sort of documentation to package the use of one or more gyms for this purpose. And I believe that we all ought to look at that. There are 16 school districts in Lane County, the ones in the metro area, Springfield, Eugene, and Bethel. But we ought to look at that sort of legal document, and advocates in the communities ought to have direct relationships. I will help in any way I can in Springfield to investigate whether or not that can be replicated closer to where some of these people are. So, I mean, I feel it, I get it. I will pursue every option that we can as a board here. And I thank you all for your input on a subject that's ripping us all apart. Thank you.
Any other comments for this morning? I appreciate everybody who's spoken and all the urgent issues that are before us today. In response to Commissioner Burney, I've been working with the chair of the 4J School Board on trying to utilize one of their gyms to expand another site for Egan. They are working on finalizing what that would look like from a contract standpoint. And so I look forward to that as we run into the full Egan season here and being able to utilize more space. Last time Egan was open, it was open at the fairgrounds at a couple of sites. They needed more space. They opened the Aurora building. The Aurora building is quite small. So we do know that they need a larger space, but as Commissioner Farr said, they need volunteers too. And that is a real challenge this year with COVID-19. So we hope that people are cautious and can still volunteer and help these folks out because it's going to get darn cold. So thank you so much, everybody, for your information. We'll talk about it more. Mr. McCallister, did you have anything you wanted to share on the subjects that we talked about just now?
I certainly can if you'd like me to do that now. Otherwise, I can do it under my announcements. I guess I'd leave that to you, Chair, from a timing standpoint. If you want me to, what's your preference?
We're talking about it now and people are listening. Why don't you go ahead?
Sure. So happy to share an update on this. We, the Lane Event Center, I think as the board knows, has been used, and we are prepared to, we've been working with St. Vincent de Paul on using that site for, that county site for Egan for the upgrade. We did not have to use it over the weekend because the temperature didn't reach the point that it needed to be activated, but we are preparing for that this week. It's my understanding we've had capacity for up to about 80 individuals, and at no point to date have we been at capacity. So one of the interesting findings that we've had this early winter season so far is that fewer people are actually taking advantage of the beds that we're making available. That certainly could be due to COVID-19 and people choosing to kind of shelter in place where they are, as opposed to going to a remote location. But that is what we've experienced. We'll see how the winter unfolds and if we get more participation. But to date, we have not had capacity. We've had excess room, excess beds for folks. I also, and I'll touch on just, on Bethel and 4J, we have worked and we continue to work with Bethel and 4J. I will say that it has been St. Vincent de Paul's preference to utilize, and some of this is, I think, as Commissioner Farr indicated, the challenge with volunteers, and also the fact that we have not hit capacity at the existing Egan operations that we've had when they've been open. I think from an efficiency standpoint, it's more challenging for St. Vincent de Paul to operate multiple scattered sites. It requires more volunteers, it requires more staff and costs, and equipment and the dynamics of all of that. And then the communication, transportation, all of those things. So we certainly appreciate, and what we're working with Bethel and 4J on is looking at actually utilizing some of their sites for winter strategies, which would be, use of facilities in addition to not just for freezing nights, but in addition to those nights. In addition to that, Springfield has made available approximately 20 hotel rooms. So they paid for about 20 hotel rooms for residents there. Lane County has purchased, and I want to just touch on our winter strategies, some things we're doing in addition to Egan. We purchased 100 pallet shelters and are beginning to locate those pallet shelters throughout the county. So Springfield and Cottage Grove and other communities throughout Lane County have engaged with us on that, and they're locating these pallet shelters in their communities and allowing for shelter of unhoused individuals. We found that to be a really cost-effective and collaborative way to deploy these really quick to set up units that keep people safe and sheltered during the winter. And it's a way that, particularly in the rural communities, if they have a site, a church or a parking lot or a place that they can locate those pallet shelters, that they can do that relatively easily. The city of Eugene, of course, is opening 75 and up to 100 additional rest stops. So that's been one of the contributions that the city of Eugene has made, is in making additional sites available for rest stops. We're also, I think, as the board knows, we're actively participating in Project Turnkey, which is a state, an application to pursue state funding to acquire a facility in Lane County that can be used for shelter for unhoused individuals. So that is actively happening. And then I'll just touch on the 100 River Avenue. I know there was a comment about individuals coming to Egan. I think we heard one or two commenters. I just want to say, and I think you hear from Dr. Ludke and Dr. Warren later this morning, we talk about our COVID-19 update. The last report I had showed that we had about 10 individuals at River Avenue. I believe 2 of them are positive and 8 of them were in quarantine. That unless those numbers have changed, that means we do have additional capacity at 100 River Avenue for unhoused individuals. That's why we purchased that facility and renovated it, was for unhoused individuals to be sheltered if they test positive for COVID-19 or need to quarantine or isolate, and don't need to be in the hospital, but don't have a home to go to, that facility is available. So that's something that obviously we've been working on for the last several months and have put into place. So happy to answer questions, and then of course the board is aware of we know that these temporary shelter options are not solutions to ending homelessness. The solution is permanent supportive housing, connecting individuals to services, and transitional housing and affordable housing. All of those things are the things that get people off of the streets and back into a more stable situation in their life. That is the proven and tested solution. And so we have to be sure that as we talk about these needed emergency shelter options that we have to and are coming up with, we can't keep our eye off the primary ball, which is to continue to invest in permanent supportive housing. Last week, before the Thanksgiving holiday, I had an opportunity to tour the brand new Market District Commons at, I'm not sure if I got that name right, but it's on county property, Homes for Good developed, 50 units that just opened. It's an incredible facility across from fair market housing at the OB development. And it's a wonderful affordable housing project that Lane County and Homes for Good partnered on. Of course, we have our MLK project that has 51 units of permanent supportive housing for chronically homeless individuals that is nearing completion, and a number of other projects that Homes for Good and Lane County and other partners are working on deploying. So we oftentimes lose sight of because those take a lot of money and they take a lot of time, and we tend to focus on the emergent visible problem that we see on the streets, and we will continue to focus on solutions to that challenge. But I also just want to call out the really important and critical work that's happening on permanent supportive housing, and that we will continue to lead.
Thank you so much. So hopefully that helps with some information for those that spoke, but do know that we heard you loud and clear, everybody that spoke, and we're working on as much as we know we can, and we know we got to do more. So we'll move on our agenda for this morning to County Administration, item 5A, Holiday Farm Fire update.
Thank you, Chair. And I'm going to, I think the screen is going over to Devin Ashbridge, our Public Information Officer. We're going to get an update from Devin Ashbridge, who has been actively involved in the Holiday Farm Fire response and recovery work. And Devin's going to walk through the new website. It's a great one-stop shop resource for folks who've been affected by the wildfire. She's going to walk through the website, talk to you a little bit about the communication and outreach efforts that we've been doing, which have really been outstanding. And then after Devin goes, we have Austin Ramirez, our Economic and Community Development Manager, who will talk about our housing task force, the update that we have from FEMA. So questions that you have about the FEMA housing designation and other matters you can hold for Austin. So Devin, are you ready to go?
I believe so. Can folks see my screen?
Yes.
Okay. So along the lines of challenges that COVID has added to, our normal work and outreach, is the focus on finding non-congregate ways to provide critical information updates to holiday farm fire survivors. And so we have put emphasis on electronic means of communication in greater proportion than I think we would in other circumstances. Our primary tool is the McKenzieRebuilds.org website, and it's meant to be a one-stop resource for holiday farm fire survivors for any services that the county may be involved in providing or help that the county can provide, as well as links to financial assistance. And so we have 6 general areas that we're providing information. This is the homepage of the website. We have information regarding financial assistance. So it's where we have resources for people who are in the process of receiving their FEMA letter on the status of their application, property tax proration. One thing we're hearing from survivors is that there's another wave of insurance companies requesting proof that they were evacuated. So under our working with your insurance company section, we have a searchable map where people can provide PDF proof of their evacuation status for each day there were active evacuations, as well as a timeline of the evacuation, so documentation that's valuable for insurance companies and potentially for FEMA as well. We have business support resources where people can get direct assistance from not only our community economic development team, but also the Small Business Development Center and other information that's available through state or federal programs. eWeb is leading the watershed work, and so this link takes them actually to the eWeb page. They're an incredibly important partner and leader in protecting the watershed of the McKenzie post-fire. Housing puts them in direct contact with Laurel O'Rourke, who is serving as a liaison with survivors and helping them connect with housing resources and working to help make sure they have what they need in order to be successful in applying for some of the assistance programs. We also have resources and information about grants for rent assistance, renter resources, and things like that. So again, trying to bring some of those most important and key things together in one place. What we don't want to do is overwhelm people or force them to search multiple websites for this information. The two most popular sections and where we've seen most of the page views is in our property cleanup and our rebuilding sections. So property cleanup is something that continues to be among our most frequently asked questions. We have prominent links to the state's debris removal program. As I'm sure that you're all aware, commissioners, the state is beginning to move into step 2, which is ash and debris removal. So providing that information so that people know what to expect, they know how to participate is important. We also know that there are some property owners who are going to choose to do cleanup on their own, and we want them to be able to do that safely and as efficiently as possible. And so we have information there regarding abatement requirements. Does your property need to be tested for asbestos? Does it not? And then how do they dispose of that ash and debris afterward? So again, attempting to bring a number of resources together. The rebuilding section has also been very popular, and it's attempted to help simplify what can be a very complex process. And I have to say our land management staff has just been wonderful in helping to provide this information. And so we have information about temporary RV permits, which, as you know, we're offering for free for folks who are able to secure an RV and wish to stay on their property while they rebuild. Locating property records, both for insurance purposes and to make it easier as they begin the rebuilding process. We are working to roll out a new tool that will actually allow them to track the permit process and where they are in that. And we actually hope to have it live at the end of this week or beginning of next. And we think that'll be an easy to use resource for survivors as well. We have information on what it's like to apply to rebuild and what people can expect, the steps involved, information on how they can create site plans, who they can call for assistance, things they need to consider for septic tanks and wells. And so this has been our primary focus in providing that information. We are also hosting bi-weekly Facebook Live updates where we bring together not only county staff, but staff from partner agencies who can answer questions of McKenzie Corridor residents and help point them in the right direction for resources or clarify things that maybe residents are wondering about. And that's been very helpful. We are working to put together an evening session focused on debris removal with our partners at ODOT. And so hopefully that will be a great resource for people as well. And then we are doing a weekly e-newsletter using the emails captured in FEMA registrations. So every individual that's registered for FEMA assistance that has provided an email, we're able to send information to directly as well. We're focused on doing that once a week in order not to overwhelm people, but to make sure that we're providing them regular updates and information. And I'm happy to answer any questions before we hand it over to Austin.
Any questions? Commissioner Farr.
Thank you, Chair Buck. Devin, I've been speaking with a couple of residents who didn't lose real property, but did sustain other losses during the fire. For instance, their well ceased to work, but their house is habitable other than the well ceasing to work. And also losses of food due to spoilage, in freezes, etc. Is there any relief that is available that you're aware of for people who didn't actually lose their homes, can still live in the homes? The fire didn't get that far other than smoke, but they were affected financially pretty severely. And as you know, and as we all know, many of the people living up there don't have a great deal of excess capacity to absorb the losses.
So we had encouraged anyone affected by the wildfire, either from destruction of property down to what you just described, Commissioner Farr, to register for FEMA assistance. That deadline passed yesterday. We had a large number of registrations, and I hope that people who are in that position chose to apply. For folks that are still working through getting rid of spoiled food, they can dispose of that spoiled food if it was due to a power outage from the fires for free at a Lane County transfer station. If they are also looking to get rid of the appliance, there is a mandatory fee of $15.25, which is what our vendor charges us to come get the appliances, remove the Freon, and then scrap the rest of it. But that's the only cost involved. And so we'd encourage people that are still looking to get rid of food that has been ruined by the fire to get that to a transfer site and dispose of it for free.
Chair Buck, thank you, Devin. Just a quick follow-up on that. So if they failed to apply by yesterday, then they're out of luck, or is there a possibility of an extension of that application? And the second part of that is that the spoiled food is no compensation for whatever value of the spoiled food itself.
Chair Buck, Commissioner Farr, the FEMA deadline was extended once. I haven't heard any indication or seen any documentation that it will be extended again. But of course, that decision is not ours to make. And I completely concur that free disposal does not replace the cost, but hopefully it makes cleanup a little bit easier for people.
And Chair Buck, Devin, thank you for all the work you've put in, all the extra time. You've helped a lot of people in a lot of ways.
I'll just add also that FEMA did recently come out with some assistance for people who may have not had enough insurance coverage to work on their septic or wells. So we shared that, the county shared that, I shared that information to folks too, and encourage them if, you know, costs are adding up and they don't have anything left over for that program to ensure that they look into it, because that is, from what I gather from FEMA, somewhat unusual for them to offer opportunities for assistance in cases where people have wells and septics.
Yes, Chair Buck, and we did push that message hard as soon as we received that information. And I would encourage anyone who has an application with FEMA to keep that information up to date, either through disasterassistance.gov, through the FEMA app. If they had already applied for FEMA assistance but hadn't accounted for the well or septic, to go in and update that application and keep FEMA apprised of any changes as well. And so for folks that did get an application in by the deadline, they can update those applications and make sure that they are staying in touch with FEMA as the application is processed.
Thank you for that additional information. I'll pass that along. And Chair Buck, I'd like to enter the queue again if there is time at the end of this discussion.
Any other questions on the McKenzie rebuilds? Commissioner Burney and then Commissioner Bozovich.
Can you hear me? Thank you, Chair. Devin, speaking specifically to this instrument, I can tell you, really impressed, really impressed. As someone who had to evacuate a home before the world of the internet, and going through the processes, including with FEMA that we went through, this would have been invaluable. So thank you for that. You mentioned some pieces of it are pretty heavily used. So my question is, can you track the use of it? And can you use, and if so, can you use that tracking to try and reach out and identify others that aren't using it? So perhaps we can reach out and provide services and support to them. Thank you.
Chair Buck, Vice Chair Burney, I can look at the overall number of page views, but it won't tell me or provide me any way to contact the people viewing those pages. What we are doing though with our weekly newsletter, that does allow me to see what links are clicked on the most and more popular. And so that allows me to continue to find better ways to provide the information, to provide links in a more prominent manner to help drive some of that traffic. We're also advertising and sharing the site on social media, which has been a wonderful tool to share this information. And we have several community-run Facebook groups that we tag in each post, and they've been wonderful in sharing that information because, as we know, sometimes the information directly from government doesn't go quite as far, but when we find those key community members
Right.
that can help share that, it's a much more powerful message. And so we're working in those ways in order to make sure that this resource gets out there.
That's great. Thank you. Thank you, Chair.
Commissioner Bosevich.
Thank you, Chair. I just a quick question. I don't know if Devin, you know the answer to this. Is the Hope Project still providing assistance with household goods and food upriver? I believe they were up through the month of October. Don't know if they're still up there or not. Just in response to some of the concerns from Commissioner Farr about maybe getting people, food replacement and making up for some other kinds of losses people may have had upriver.
Yes, Chair Buck, Commissioner Bozovich. There are still resource centers operating upriver. I don't know how the hours may have changed given some of the additional COVID precautions and things like that. But we have community groups working to provide resources at the old Leeburg Fish Hatchery, at McKenzie School, and at the Upper McKenzie Community Center. And they are doing an incredible job providing just those kinds of resources for survivors. Food for Lane County, of course, is another amazing resource in our community, and I believe they have been involved with those resource centers as well. So there is help out there, and I would encourage people to consider visiting one of those relief centers. The McKenzie Community Development Corporation is one of the driving factors behind that, and they're just doing a wonderful job on outreach.
Thank you.
Thank you. And Devin, I want to make sure I give credit where credit's due. Who was the designer of this McKenzie Rebuild website?
It was a team effort, Chair Buck. So I have to give credit for the logo and the icons and that level of design to Carrie Lutz. She's a designer in the community that I've worked with before, and she did a wonderful job very quickly for us. And I worked closely with waste management, land management, Austin, Laurel, and a lot of folks on the recovery team for the content. And then I spent an amount of time that I will not disclose arguing with Squarespace and Googling how do I on Squarespace to get the website up and going.
Wonderful job. Thank you so much to everybody who worked on that. I think at this point, we'll turn it over to Austin for the second part.
Thank you, and good morning, Chair Buck and Commissioners. I also just wanted to add to the question of a FEMA registration extension. We did learn late yesterday that there may be a bit of a grace period even past the extension. It will require a different process and a different set of documentation is what we heard. So we're working to clarify what that process is exactly for folks who may not have been able to meet the extended deadline. So there is, it sounds like, still hope if you were unable to register, and we'd encourage folks to reach out if they feel that's the case. I do want to update you on the request for direct housing assistance from FEMA. Last week, unfortunately, FEMA denied the state's and our request for direct housing assistance for Lane County wildfire victims. If approved, this would have made a suite of housing assistance options available, including direct lease, which is where FEMA leases rental properties directly with those owners for wildfire victims, multifamily repair and lease, where FEMA repairs multifamily units and then direct leases those, temporary housing units, which are the traditional sort of FEMA trailers or RVs, and then group site acquisition and development. So this is where FEMA supports the acquisition and development of properties that would have been suitable for group trailer sites. Their rationale for denial had two parts. The first, they did not feel that it was safe to provide or support housing options in the McKenzie River area due to slide and flood risks, as well as environmental and infrastructure concerns. In response to community needs, we have been focused on identifying safe and secure housing options in the McKenzie River area. we know for personal and employment reasons, there are several people who, even if it's difficult to remain in that area, would need to, but FEMA did not feel like it was safe to do so. The second reason is that they felt the existing rental inventory in the Eugene-Springfield area would be sufficient to meet the number of wildfire impacted individuals in need of housing. They came to this conclusion because based on their analysis of Lane County registrants, 63 people would be eligible for a form of direct housing assistance. Because they increased the rental rate assistance to 125% of fair market rate, based on their inventory analysis, they feel that that would make over 80 rental units available in the Eugene-Springfield area or along the I-5 corridor. So the news in this denial is incredibly frustrating and disappointing, to say the least. I would disagree with many of their findings, but I would say it's important to note that while this removes the 4 forms of direct housing assistance I mentioned, this does not remove all forms of FEMA housing assistance. So that could include increasing the rental rate assistance beyond the 125% it currently is, as well as some other options. We are meeting with them this week to clarify their findings and to learn more about other forms of housing assistance. We're having the same meeting with Regional Solutions and OHCS and the governor's office to really talk about, now that we've been denied for direct housing assistance and in the absence of those resources, what is available, because we do know that triggers other resources. So I wouldn't say this was the only solution we were working towards. It wasn't the only resource we were relying on, and it certainly doesn't mean that FEMA has stepped out of the picture completely. They were pretty proactive in their outreach to us after that denial in terms of setting up follow-up with us to talk about what options are available. We're also exploring the appeal process for this decision, which we may pursue if feasible and applicable in this situation, but we do just need some clarity and to learn more about what other options are available. Again, not the only strategy or resource we were pursuing or continuing to pursue. Project Turnkey efforts continue. That application was submitted. We hope to hear back from that program in about a week and hope to move forward into the next phase. There are multiple phases for Project Turnkey. We also are continuing to work closely with Oregon DHS to talk or to contract with lodging and housing facilities throughout Lane County, and including in the McKenzie River area, particularly as Red Cross ends their contracts at the end of this calendar year. So we're continuing to transition folks from Red Cross hotels to more sustainable housing options. And we're also working closely with Homes for Good on short and long-term housing goals for our wildfire victims, as well as other important community partners. I'm incredibly frustrated by the decision. I know the community is, I know other staff are. It's certainly not the end of our pursuit of this resource. We are still exploring it and others, and we look forward to continuing to serve the McKenzie community and provide housing wherever possible. So a bit of unfortunate news to share, but just wanted to make sure you all have the latest information there.
Thank you, Austin. It's incredibly disappointing, and I know that we'll continue to work on the housing issues, even if we disagree with FEMA's analysis, because we're going to have, at the end of this month, potentially a lot more people unhoused again, and we just have to find housing for these folks. It's just like all the resources that we know are there, and we can't touch them, and it's so incredibly frustrating for a place that has the second highest housing stresses in the United States to not be considered, for FEMA to say that there's enough housing available. Just doesn't make any sense. And there's a lot of people that are not going to be covered by FEMA through a housing assistance that will also need homes and places to go that are affordable, that we just don't have in our community. Any other comments, questions from commissioners? Commissioner Farr.
Thank you, Chair Buck. And Austin, thank you for the work you're doing. Once again, you are doing at least 4 jobs right now. It's amazing how much you're able to accomplish. Just a question that I've asked you before, and I don't really know that we have an answer right now. I am still concerned about what I perceive to be a large number of people who are living more or less off the grid, whose homes were destroyed. And the people that I'm talking about are people who lived on unregistered RVs, potentially behind existing houses and existing properties. I know that is taking place all over the county. Most of the time we look at it and look away because we acquiesce that people are living in a better place and not having a roof over their head. It's happening outside of the McKenzie region. I know it must have been happening on the McKenzie. I don't know if we have any way to keep track of those folks or any way to provide assistance because they've not been registered in any way. Austin, just letting you know that I'm still thinking about that, and I know that I'm not the only one.
Thank you, Commissioner Farr. That is also top of mind for us. We were talking yesterday around strategies to communicate with this group of community members. And we're still working on that and figuring it out, but we do have a lot of community partners doing outreach. I'm thinking of Whitebird in particular, that typically reaches populations that are otherwise unreachable. So we are putting together a strategy to try and reach those people. And I would also say that is what we think has skewed our FEMA registration numbers down the lowest, because in the FEMA system, only one person can report an address. And we know in the McKenzie, there are properties where 4 or 5 different families live all on the same address. But FEMA only counts that as one family, and it marks the rest as potentially fraudulent or as needing more information. So it has definitely hurt us thus far, and is something we're continuing to be mindful of and to put together strategies. But thank you for continuing to flag that.
And thank you, Austin. We all thank you for your continued addressing the situation. We know many people living in such a situation are in fact veterans as well. And McKenzie Rebuilds has a special location, a site location for veterans to access. So once again, thank you.
Thank you.
We'll go to Commissioner Burney, and then we'll need to move on with our agenda today to fit everything in. Commissioner Burney.
Well, thank you, Chair. Austin, I'm going to skip the accolades. You know I appreciate you. With the second most constrained housing market in the United States, with housing affordability off the charts given the low per capita income, I'm curious how the hell FEMA and with something that Heather Selecky mentioned this morning, that reality on the ground needs to inform policy. I'm wondering how the hell FEMA denied this and what recourse we have to input that, because we all know that that's just an incorrect conclusion they came to. And there are lives on the line. Please, thank you.
And I would agree completely with what Heather mentioned earlier today. I was listening. We are exploring that appeal process now and trying to figure out what that is exactly and what that looks like. I would say they are likely using flawed data or data that does not reflect the truth on the ground. And we know that. We've told them that. They should be aware of it. But we do need to continue to reinforce that fact, particularly as Laurel works with folks who aren't eligible for FEMA but need resources. And many who should be eligible for FEMA but got lost in the registration system. So while we're continuing to work with them on other options, we are also exploring that appeal process to determine how we would do that the most effective.
Thank you. Thank you, Chair.
Thank you, Austin. Appreciate the update, even though it's a depressing update with a housing commission issue. We'll keep working on it. And we'll move on to our item 5B, our COVID response and recovery.
Thank you, Chair. For the sake of time, I'm going to go ahead and turn it over to Dr. Jocelyn Warren and Dr. Pat Ludke, who are with us today as special guests to provide an update for you on COVID-19 response efforts. So Jocelyn, do you want to take it away?
Hi, thank you, Steve and Chair Buck and commissioners. We're here today to provide an update on the COVID response. Dr. Ludke is going to begin with a look back and a look forward, and then I will provide an update on services. Pat?
Thank you, Jocelyn. Chair Buck and Commissioners and County Administrator Steve, thank you all. Today is actually an interesting day to do this. It was 9 months ago today that the first person identified with COVID in Lane County became symptomatic. And as Jocelyn and I were teasing and toying through our response and recovery efforts over the last 9 months, it seemed that this is really a kind of a fortuitous day to do that look back. And I'm going to couch it in essentially kind of a gestation, kind of a 9-month pregnancy. And I apologize for that, but it just seemed apropos. So the first trimester, March, April, May, we were looking at this foreign invader. Most of the people who were symptomatic had been traveling. They were on cruise ships. They had been overseas. It was a time where it was mostly adults and a lot of older adults who had this condition. And it was a challenging time trying to understand how we were going to prevent severe disease. The governor initiated her Stay Home, Save Lives Act. I think it was March 23rd. And we closed down a fair number of businesses and then put plans together to start looking at how we would reopen our communities. The summer came, so second trimester, June, July, August. We went through our reopening phase 1, then phase 2, and a whole lot of planning occurred in public health and across our other collaborative agencies, trying to prepare for what we thought was going to be a pretty nasty fall. We had been looking at other coronaviruses. As many of you know, the common cold has a lot of different viral causes. Coronaviruses are one of those causes. And the common cold viruses, they just love late fall and early winter. And there was no reason to suspect that this new novel COVID-19 virus would be any different. So that second trimester, June, July, August, a whole lot of planning and a whole lot of work with businesses and schools, colleges, universities to try to prepare for what it might look like in the fall. Unfortunately, the third trimester came about the second week of September. Our numbers started to increase massively. By way of comparison, it took us 6 months to get our first 1,000 cases. It took another month, 30 days, to go from 2,000 to 3,000 cases. It only took 10 days to go from 3,000 to 4,000 cases. And we're at a part on that curve that is just not where we want to be. But this is what late fall looks like with these types of viruses. Unfortunately, that's what we're enduring. So in this third trimester as well, takes us through yesterday, November 30th, a good deal of clinical collaboration, a good deal of planning ongoing, and then implementation, operationalizing all of these plans. And I'm going to start now or transition now to some of the numbers as of this morning. We are at 4,462 cases. As of just a few moments ago, was able to update that with our latest numbers this morning. We have 39 persons in the hospital. This is a record. This is the most we've had in the hospital. 9 of them are in the ICU. While you have been talking with the community, I've been texting back and forth with McKenzie and Peace Health chief medical officers, and they are getting a little bit nervous. They're not overwhelmed, but they have a large number of cases. We're at 43 deaths, and our death rate is right about 1%. Putting that into perspective, typical influenza season, not a pandemic influenza season, but a seasonal influenza season, the epidemics we have every season, the death rate's about 0.1%. So it's 10 times that in our county. Just north of us in Marion County, it's 1.5%. In Yakima County, Washington, it's 2.5%, significantly higher. It's interesting to look across these other demographics, these other areas, and compare. But again, we're at about 1%, and that rate has been dropping over time. Thankfully, we've learned a lot in those 9 months. Early on, we didn't have any antivirals. We now have one antiviral that's been approved and used, remdesivir. You probably know about it. We also have had some very clear data points on using steroids in people with severe disease in the hospital. And that has been very helpful to decrease some of the inflammation that causes more severe disease and death. So we have seen that death rate drop over time, which is what we see in most pandemics. As we learn more, a new novel virus, novel bacteria, we learn something and the death rate drops a bit. But it's still 10 times a normal seasonal influenza epidemic, at least in our jurisdiction. Regarding current outbreaks, we have 76 outbreaks that we're tracking in Lane County Public Health. It's a lot of work. We have approximately 700 people under monitoring that we are making phone calls to, making sure that they're doing okay. When they become symptomatic, we have to connect them to testing to see if they have COVID or if perhaps they have influenza or some other circulating agent out there. But that's just a lot of work. Of those outbreaks, the numbers representing the highest penetration, so to speak, have changed over time, which is what happens in outbreaks. Currently, long-term care facilities represent 35% of those 76 outbreaks that we currently have. Workplaces, and of course there's a variety of workplaces in our county, but workplaces represent 25%, and 23.5% are linked to the University of Oregon, whether it is a Greek facility or some other facility of Oregon. So again, 76 current outbreaks, 35% long-term care facilities, 25% various workplaces, and 23.5% linked to the university. So here we are, December 1st, 9 months. We've given birth, the gestation is over. And what are we looking forward to? What's coming up next, perhaps in the next 9 months? Well, there's a lot of things happening. Today, ACIP meets. That's the Advisory Committee on Immunization Practices. It's a advisory committee for the CDC, and it helps decide how vaccines are used. So the FDA approves vaccines, but the FDA doesn't approve how to use them, how to put them into the current immunization protocols that we have. And today, ACIP meets, and they will determine those vaccine priority groups. When the COVID vaccine comes, who's going to get it first, who's going to get it second, et cetera. They will also decide on the required safety monitoring going forward. As you all likely know, we don't just approve a vaccine or a drug and put them out on the market because things can happen 1 month, 6 months later that we didn't anticipate or see in our clinical trials. We mandate that ongoing monitoring occur and reported back to the FDA to ensure that those new products, like vaccines, are safe. So ACIP will make that decision as well today. 9 days from today, on the 10th of February, the 10th of December, the FDA will review the first application for a vaccine to be approved. That's the Pfizer vaccine. I know we've discussed this at prior presentations from Public Health. Many suspect that will be approved, and within a very short period of time, the roughly 6 million doses that Pfizer has already manufactured will then be released to the market. So we might get a trickle of vaccine in Lane County late in December. It'll be a small number, certainly not enough for our nearly 400,000 residents, but we might get a small amount of that. About 2 weeks later, the FDA will meet again to discuss the second vaccine, the Moderna vaccine. And hopefully that EUA application, the data will look good and it will be approved and we'll have another vaccine becoming available to us. Which leads me to our vaccine efforts and our planning and how we're going to get this vaccine utilized. We have a vaccine implementation team. Cindy Morgan, who you know well, has come out of retirement like a Major League Baseball player coming to bat again. She's working for us part-time to help lead that vaccination effort. And that will be our template moving forward of how we're going to get the maximum utilization of that particular product to decrease the risk in our community. Other operational changes that will occur and have occurred, you've already discussed a bit about the county fairgrounds. That site, of course, was used for several months for housing early on. The Expo Center, the Wheeler Pavilion we used for a couple months during the first trimester. And it's been used now for multiple testing events as well, and it will be used again for other purposes. We have ongoing work at the River Avenue VA clinic that you authorized the purchase for, and Steve Mokrahysky mentioned. We do indeed have 10 people there now, 2 who are positive, 8 who are quarantined. The census at that place has been up and down. We've been at maximum a couple times in the last couple weeks, but it has dropped a bit recently. So we will have these up and down volumes of disease going forward, and we will be addressing them through the various efforts that we have put in place, including the fairgrounds, including River Avenue, including our contact tracing team, et cetera. So I'm going to stop there, pitch it to Jocelyn for some further updates on COVID services, and then together we will take questions and comments.
Okay, thanks, Pat. Pat noted that we've had a surge in throughout the state in COVID cases recently. And with that, the Oregon Health Authority released guidelines for modifying some of our case investigation and contact monitoring practices in order to better manage the surge with the staff that we have. Among those suggestions, and the surge actually applies to about 21 counties in Oregon. So this is pretty common across the state. There are some cases, some counties that are untouched, but they're quite few. So one of the changes in case investigation includes reducing our phone call attempts to 1 from 3, and then following that up with a text when possible and a letter to all cases. So we continue to do that. Workplace notifications, which do take quite a lot of time, have been limited to congregate care settings and food chain businesses, including processing plants and packing houses. That change was made in recognition that those are the sites in which disease transmission is most common, and which our efforts to prevent and mitigate those that transmission are most successful. And then they also, at OHA, reduced the number of questions in the case investigation interview. It's quite a lengthy interview, so that has also made a difference. Part of the problem has been that the state systems have also slowed dramatically with an increase in cases and an increased number of testing being reported and a lot more people being in the system. So we noted, for example, that we sometimes go to a paper form for case investigation. If the state system is too slow, we can do 10 to 15 in a day per case investigator if we do it on paper. And then if we are doing it in the state system and it's a particularly slow day, we may only be able to do 4. So that's made a big difference in our ability to respond as well. The other difference to contact monitoring has been moving to a similar notification process. We make the first call and then also send a letter and a text if possible, and then are responding to needs as they come up from those contacts. Case management hasn't changed much. The ability to support people who need to isolate and quarantine is really key to reducing transmission in our community. So we continue to do quite a lot of that. I can tell you that we have a total open cases right now of 284. 211 of those are within the community, and 73 are being handled by University of Oregon team. That team continues to be very helpful in terms of both the contact monitoring and the case management services. In addition, there are 9 households that are now receiving case management in hotels. So that is something that we're going to be seeing increasingly, our whole families that are needing care as well. The other thing I'd like to mention is that we do rely on a number of community-based organizations to assist with the case management pieces, and that's primarily food and hoteling issues. And the state has also contracted directly with a number of CBOs in our community and a statewide CBO to provide services in Lane County, which has been really helpful. I want to give a particular shout out to the Chinese Friendship Association of Portland. When we had a surge last week, we had a number of people in hotel rooms, and it increased dramatically, and the burden on staff was quite a lot. They were able to step up and deliver daily meals for our unhoused folks that were in hotels for quarantine for about a week, and they continue to do so. And that had been really, really helpful for our staff. And that was something that the Oregon Health Authority helped to arrange as well. So we continue to meet those food and medical needs for case management within 24 to 48 hours while in surge capacity, because we recognize that that's very important. Our current CBO capacity is at about 25% of the need. So our staff is still providing about 75% of that case management. We would love to expand the capacity of our CBOs in that direction. I know we've worked with OHA to see if there are possibilities there, but yes, especially going into this winter season and considering the needs with the Holiday Farm Fire too, a lot of our CBOs are really stretched and don't have the capacity to do more in that area. We are working more with St. Vincent de Paul. There is actually a meeting ongoing right now about the Egan Warming Center as well, and try to troubleshoot some options for doing screening and being able to at least provide some isolation space for sure, or quarantine space for those who are symptomatic and potentially COVID positive at River Avenue. We do have some capacity there right now. So that changes a lot, as Dr. Pat said, up and down. The other piece we have is the call center. They continue to field calls from 8 to 5, Monday through Friday. That service has not changed. It's been pretty steady over the last few weeks. The number of calls that go directly to nurses tends to change over time, but we still see a pretty high number of calls to there. We haven't noted that we have a lot of calls that are dropped over the weekend. So if that tends to tick up, then we would at that point evaluate whether or not we would have to expand hours again. The other pieces of our response that are ongoing are the testing team. They do some really great work. We have called it sentinel or surveillance testing because we are targeting the high risk groups in our community or those who are generally underserved, and we continue to do that. This team has also begun to pivot to be able to do some more testing in outbreak situations. The state is able to respond often to long-term care facilities, but in other facilities such as we had one that was targeting at the Eugene Hotel, for example, last week, not strictly a long-term care facility. So they needed some support in testing, and our team was able to deploy there to do testing, and that was a very successful event. But the team does continue to do testing with groups like HIV Alliance and Central Latino, and we will be doing another testing event December 13th for the Black African American community locally. In addition, sometimes they're able to also provide flu shots. As you probably know, our last mass flu clinic was canceled because the conditions were frankly pretty unsafe with those large tents blowing across the Lane Event Center parking lot. It has been rescheduled for this Saturday from 10 to 4 at the old eWeb building by the Washington Jefferson Bridge. So that is completely free, open to everyone. We do use these events as well for practicing for COVID vaccination and kind of getting a sense of what mass vaccination will look like and mean for us. There are big differences in terms of tracking because the COVID vaccine will be 2 doses and the flu vaccine is only 1. There are some technical issues that are very different and potentially handling issues, but it is helpful to think about how we manage parking or car traffic and paperwork and things like that. So that should be a really helpful event on Saturday as well. We also have a group of Peace Health nurses who have volunteered for that event and who are helping us. So we also thank them very much for their time and effort. I just want to give a quick update on some other areas. Note that in terms of PPE, things are looking still pretty good here locally. You'll be happy to know. The monitoring continues daily for our hospital capacity, as Dr. Pat mentioned. There hasn't been a surge in ICU or vent use, but of course, as you also mentioned, our hospitals are beginning to get a little bit more worried about those things as we see some much more acute events happening across the country. We've also had really great assistance from some of Austin's team in our business outreach. We do get a lot of questions from businesses about how to either respond to a case in the workplace or prevent cases or how to comply with the guidance from the governor. And his team, both Jenna and Alexandra, have been a tremendous resource to us in helping us follow up with those groups as well. So many, many thanks to them as well. They continue to provide weekend coverage as well in outreach to businesses. And so if there are any questions about COVID, they are encouraged to reach out to that team. Their contact information is available on our website. And I believe that is all. I do want to mention that the state is moving to a new framework to kind of talk about the level of COVID-19 spread. So you may have seen some news about this. It's meant to also align with the school metrics to make it easier for everyone to understand, so we don't have all these multiple ways of measuring spread in our community or our community risk. We will be in the extreme risk category, which is at 200 or more cases per 100,000. Our current, our school metrics were just released last night, and for the 2 weeks from November 15th through November 28th, we had a total of 1,051 cases. Our case rate is 277.4 per 100,000, and we have a test positivity rate of 3.6%. That does reflect that we have fairly good access to testing here locally, especially as compared with some other counties in the state. We've been very lucky in that regard with the folks that have stepped up locally to provide testing, so that all of our testing doesn't have to go out of county or out of state. And so we are working with the schools as well. They're all, very interested in these metrics and what will it take and when will they be, able to consider moving back to a hybrid model or some in-person learning. So those calls continue weekly. It won't happen for some time, given that we're in the extreme risk category, but we are talking about whether and when we suggest that people have to consider whether or not offering limited in-person instruction is still a good idea considering spread in the community. So we'll be having that discussion this week with schools as well. And I think that's all I have for an update. So we're happy to take questions.
Thank you so much. Any questions for our presenters? Commissioner Bozovich and then Commissioner Sorensen.
Thank you. First, real quick question, Dr. Ludke, is the 4,462 cases, do you believe that's an undercount of the actual cases because of our early inability to get testing and current testing limits?
Oh, definitely. I think it's an undercount. The question really is how much of an undercount? And there's some modeling on that done at the state level. But yes, I think it is an undercount.
Yeah, so the 1% death fatality rate probably is actually lower.
Well, perhaps, because we don't have all the data on the same side, counting all of those deaths. We know, working with our county medical examiner, Dr. Davis, that he has not seen huge numbers of those deaths. But of course, it sometimes takes 4 to 6 months for medical examiner cases to be fully reported. So we won't know that data for the actual number of deaths in his space for some time either. So I think there's a parallel uncertainty on both sides.
I'd have to say that I think the death count may actually be higher than actual, but I'll get past that to a question I really have, which is, has there been any outbreaks traced to gyms and fitness facilities in Lane County outside of college settings?
Well, I wouldn't say I have that on the tip of my tongue. Maybe Jocelyn does. I know when the governor put the order in place a week ago, 2 weeks ago, there were 3 current gym outbreaks in Oregon that week. I don't know the number for our county. Perhaps Jocelyn does.
I don't believe we have, but I can get some definitive information on that for you, Commissioner.
Yet we have 123 cases traced to U of O Greek Life right now. And our current extreme COVID, rating as a county has us shutting gyms down and leaving the University of Oregon completely open, basically, and including the Greek Life system. My concern is the restrictions connected with the matrix make absolutely no sense for our community. You know, we're closing down restaurants when one of our highest case counts comes from social gatherings. So we're actually shifting people from a fairly safe setting in a restaurant to doing stuff at home and putting pressure on people to have social gatherings at home. You know, and we're not touching the U of O, which is one of our largest sources. And I'm not seeing much of a concentration on how we're going to deal with long-term care facilities, which is our absolute worst problem and our most vulnerable population. Is there some way Lane County, as the local Board of Health, can appeal to the Oregon Health Authority to change the restrictions in that matrix?
I'm happy to start, Jocelyn. There's several pieces to your questions, Commissioner. I would say first, we do have regular dialogue with OHA in several spaces. First, we work through CLO, our Conference of Local Health Officials. That represents the 33 local health departments, to be a unified voice. And we have had some victories in that regard, changing the investigative guidelines, changing some of the closure recommendations, changing the metrics for schools. You've probably seen the school metrics change. They were initially one size fits all, and it really didn't make sense for some of the rural and frontier districts. We got those changed as well. So that's number one. Number two, the Health Officer Caucus. I'm the chair of that caucus for the 33 local health departments in Oregon. We speak regularly with OHA's SHA team. That's their senior health advisors, cajoling, leaning, nudging, and also listening to their recommendations and their thinking. So I think there's opportunities there. The other point I feel a little bit of a need to address, partly because of huge amount of time I've been spending with the university. I think I'm back up to 60 days straight working, you know, not a single day off, going to football games to make sure that the home games are safe, the women's basketball game on Saturday, spending hours there, being the safety monitor, doing evening meetings with the Greek system, FSL as they call it, fraternity and sorority life, with President Schill. Huge numbers of hours. I can't tell you the number of hours I personally have put in liaisoning with the university to improve safety. And it's not just me, it's our communicable disease team. But I take your point well. I think there still are opportunities for improvement and challenges. And one of the goals of our COVID response plan does include economics. That's clearly one of the top five. Well, there's only five. It's one of the five that we continue to talk about what's the right thing. Jocelyn, you want to add anything?
Yes, thank you. Commissioner Bozovich, I do believe there is opportunity to weigh in with the governor's office. I believe they have a Friday call for commissioners, and that would be an opportunity, one opportunity. You can reach out directly to the governor's office. I know these directions often come from the governor's office and not necessarily from the Oregon Health Authority. They certainly consult with the senior health officers and are reviewing state level as well as national data in terms of transmission. So there may be examples in which it does not reflect Lane County data potentially. So that there is, I would say probably the justification from their end would be that they're at state level and are easier to enforce or implement it that way. But that would be a question for the governor's office if there's any flexibility in those.
Well, first, I'd like to point out that legal counsel has recommended that we do not have a quorum of our board show up to those Friday conversations. So I have not been participating because I understand our chair has been. Second, it still bothers me that we're putting people out of work in industries and creating an economic crisis not based on science right now. You know, I am not seeing data anywhere that shows our health and fitness industry is a leading source of transmission, but I am seeing huge amounts of data that the university system is. But the difference is that the fitness and health industry folks are private and the U of O is all public employees. And I have a feeling that has a lot more to do with that decision. I know they're working hard to try and be safe. The problem is you're dealing with a very social group of people that is refusing to adhere to those recommendations. when they end up, having parties that get broken up by the EPD, a weekend or so ago that were several hundred people, no mask, no social distancing indoors. We need to have our restrictions based on science. And we need to think, it's not just about the economic impact. If they're not based on science, we're creating economic impact not based on science. And right now we're shutting down two critical pieces of our economy for almost no reason. And we're going to actually put a lot of these people out of business with this current shutdown in the health and fitness industry and also in our restaurant industry. And we have got to get a message to somewhere up in the governor's office and OHA to look at the data, do things based on where the actual transmissions are happening. And then don't do things that are actually going to encourage people to have social gatherings at home, like closing safe restaurant, services. It amazes me. It seems so unscientific.
I just want to clarify the meetings that are available to the chairs of the county. So I have been invited to regular meetings with the governor's office with Leah Horner. Those used to be weekly. They're now bi-weekly. And those are on Thursday afternoons with Blaine, Lynn, and Benton County. And each group of counties has a different meeting with her. We occasionally impromptu get meeting with the governor herself. These are all virtual meetings with the chairs of the county. And I cannot determine when that will be. It's usually when there's a change that wants to be made. With the new metrics that came out, we were not consulted as to what they were. We didn't hear about the new metrics until after they were presented to the public. So there is opportunity now that they're presented to have feedback. And as you can probably understand, many commissioners have presented feedback, very similar to what Commissioner Bozovich has mentioned. I don't know how much influence that really has with those at the state level that are making those decisions, but we continue to advocate. So I just wanted to share if there's Friday meetings, maybe that's with ASC. I'm not sure, but it hasn't been with an invitation to the chairs on that particular day. Commissioner Sorensen.
Thank you very much. Couple of questions and a couple of comments. Regarding the 9 ICU patients, how many ICU beds are there in Lane County? Is 9 a high percentage, a low percentage? What percentage is 9 of the ICU capacity in Lane County?
Chair Buck, Commissioner Sorensen. So I'm going to pull this out of my head. It's going to be close to accurate. We have somewhere around 75 available. It's not going to be as close to accurate as I want it to be. Total ICU beds is only a few dozen. Most of them are at Riverbend. There are a few at University District for Peace Health, and McKenzie Willamette only has a handful. And while I'm waiting for your next question, I'm going to dig up that data for you because I have it in an email from those hospitals.
Okay, so that'd be great if while I'm talking, you can look that up. One concern I have about the ICU number is that, well, first of all, I have had the unfortunate experience of being in the Riverbend ICU. And while I was there, which was 12 hours, I learned a little bit about ICUs, and, they're very precious spaces within the hospital. And so 9 of, quote, a couple of dozen, I know you're going to get a more accurate number, but that is a very high number. And that is not put out to the public on the daily update. What is put out is the number, i.e. 9. And if you didn't know anything about ICUs, you go, well, 9 out of, 5,000 or 1,000 doesn't seem very high, but when you then dig into it and realize how precious these ICU beds are and these rooms, they're not just beds, they're complete rooms with lots of equipment, heavy staffing. That to me is an alarming number. And I think it is something that if the public were informed of that number that you're going to give me at some point today, or maybe in an email, or maybe even put on our release number when we announce it each day, that would be valuable. I'll pause briefly in my questions to ask if you have found your current estimate of the ICU capacity of Lane County.
Yes, sir. So Peace Health normally has 48. According to their chief medical officer, it's a bit more fluid right now. So Riverbend 48 and 8 additional at University District Hospital. They don't have any in their Cottage Grove and Florence facilities, no ICU beds there. McKenzie Willamette, I'm still looking up their total number. It's not nearly as many, but I can get that after your comments.
Okay, that's very helpful. And like I said, maybe in terms of putting that into some perspective, if we're reporting the total number of ICU patients out of how many ICU beds. And then my second question is, when I was trying to get out of the ICU myself, figuring that I was more tired of being in the ICU and wanting to get out, I asked, well, what are the other kinds of patients in the ICU? Who are these other people that I can see across the way from my ICU room? And I must say, there were a lot of people that were in really desperate situations. Several of them died during the 12 hours I was there. And so I learned as a non-medical person that when you get put in ICU, it can be really serious. And I stopped clamoring to get taken out of ICU when I learned a little bit more about, how important it is to provide those services to patients who are warranted to be in there. So my question is, who's being displaced from the ICUs as a function of these COVID patients that now we're up to 9 in the ICU? Who's being displaced? Who's not getting into the ICU now that we have to put COVID patients in?
Chair Buck, Commissioner Sorensen, I appreciate the question. So the number for McKenzie, by the way, is 14. So those three numbers, Peace Health, Riverbend 48, University District 8, McKenzie 14, no beds at Peace Harbor for the ICU or at their Cottage Grove Hospital. So it's a really good question. And this is actually the fear that most of us in either the clinical space or the public health space have when a pandemic gets out of control. That you overwhelm the hospital, and then those other issues that don't stop, like heart attacks and strokes and car accidents and skiing accidents, etc., don't find a space in the end. There's no bed in the inn because the hospital is filled with COVID patients. Now that has not happened here. It did happen in Seattle for a time. It happened in in New York City for a time. It happened in northern Italy, the state of Lombardia. It has not happened here. Our hospital chief medical officers tell us that they're nervous, but they're not overwhelmed at this time. And when an overwhelming pandemic happens, the first thing you nudge out are these elected procedures that may put somebody into a critical care need. So somebody who has heart surgery, and for a time, of course, they really need ICU beds. Someone who has a lung surgery, it's an elective surgery. You can choose the date occasionally. But those get nudged first, and then you end up nudging other critical care items that you really wish you wouldn't have, like a bus accident that ends up with 30 people injured, several critical. Where are you going to put them if the ICU beds, the ventilators are already full? You make do with people doing manual ventilation, squeezing the ambu bag, squeeze for hours until a ventilator becomes available. So that is the biggest concern. We have not been there. We have not really come that close yet. I can tell you as of today, speaking with Dr. Versage, the chief medical officer for McKenzie, they are at capacity right now for their ICU. That's, I believe, the first time they've been at capacity. but they are looking to discharge several today who have been stabilized. So that's good news.
Okay, well, thank you very much. Now, as to my comments, or I mean, another question, I think this is for Dr. Warren. We've gone, from March till now, increasing numbers of deaths and ICU and total numbers of cases and estimates of 8 times the reported cases. So we've got, basically all these numbers are going up over time. And you've basically stuck with the public health option of telling people to wash their hands, don't breathe on each other, wear masks, stay apart. And that repeating message has gotten us to where we are today. Some would say that that's good because we have lower numbers per capita than other places. But others might argue that if we keep doing what we're doing, we're going to see the numbers go up. And my question is, what is the reason that you have not recommended additional, and I might add, scientifically based recommendations for the Board of Health and the Board of Commissioners to take to implement policies and actual ordinances that will reduce the number of infections and deaths and ICU usage in Lane County? What is the reason you seem to be stuck on this idea of just voluntary compliance and not really making any policy recommendations for us, for the board? What's the reason you don't want to change?
Chair Buck and Commissioner Sorensen, we are willing to re-examine that, absolutely. And if that were the direction of the board, we would be happy to bring an ordinance forward for, and I assume that what you're referring to is something about enforcement. I believe that that has been a challenge across the country. And even in places where there is enforcement, there is still a heavy reliance on education. And I think part of the reason for that, and we absolutely continue to monitor what happens in other jurisdictions across the country for what can be successful in terms of changing behavior. But behavior change is among the most difficult things to do across all types of health issues, in terms of lots of things. But it is a challenge. I think enforcement is the issue, and people tend to rely on education because you can force those very behaviors then into a place where they're just not visible. So we've seen that with lots of other things, including mask wearing or social gatherings. I guess what we continue to believe is that if people really understand the risk and take it seriously, and the behavior we want to see is modeled broadly by leaders in our community and people who are influencers, that we can make a change. It does seem like some people don't believe that something is real until they have personal experience with it. And as the virus becomes more widespread, we are certainly going to see more people having personal experience. That's really unfortunate, and it's not a good reason to continue. But if there is interest in us bringing forward additional ordinances or ideas around that, we would be happy to do that.
Well, I would just say that in my lifetime and your lifetime, we have seen a tremendous change in the public's attitude about smoking, and in particular, cigarette smoking. And the first 20 years or so of the effort to minimize smoking was voluntary, telling people that it's deadly, that they could die. And there was fights over labeling cigarette packages. And then people began noticing that this educational effort bore little or no fruit, that the marketing by the cigarette companies, or in our case now, the politicization of the issue by our current and hopefully outgoing president, resulted in mixed messages, just as the tobacco fight had mixed messages with the cigarette industry paying for scientists and paying for lawyers and public relations to discount the threat. And so finally, 30 years in, there began an effort to price the product out of the hands of many people. And I would contend that the pricing as well as the education worked hand in hand, that education by itself failed, and that pricing, or in this case, fining people and getting tough with people about their infecting other people and killing other people as well as themselves, is a comparable thing. And I would just ask you to think about the parallel between the failure of education alone as a strategy in the tobacco effort that I think American public health deserves tremendous credit for solving, or at least mostly solving, and just realize that you put it back into our pocket by saying, well, if the board wants to move in that direction, I would say that public health needs to assert itself. And if you think it would be good to do it, then make a recommendation to do it. If you don't think it's worthwhile, if you think that what we're doing now works and is working and will be successful, then I agree with you. You should not be making recommendations for scientifically based regulations. I like to second the concern I have about how unfair some of these regulations seem to me. If you're dining at a restaurant outdoors, as I was 2 weeks ago in Eugene, with heaters, outdoor heating, very distant from each other people, and yet that now is banned, and yet we're having these outbreaks because people are traveling here in cars and in airplanes. We're letting people come by the thousands by airplane. They're socially not distancing. They're going for small home-based gatherings, and yet facilities that have gone the extra mile. My dental office, oh my God, they've got.
Commissioner, I just want to remind you, we need to move on with our agenda. So
I'll just say I'd like to hear Dr. Warren's response to why they have not made recommendations, why they're staying the course, and simply dropping back on their education philosophy, which I think is not working. Thank you.
Chair, if I might respond to that, and certainly Dr. Warren and Dr. Ludke can respond as well, but I've heard these criticisms now for several weeks, and I have been very quiet about it with respect to the right of commissioners to raise concerns in a public forum. But I have to say that these unfounded and really unproductive criticisms of our public health professionals who've been at the front lines for 10 months of responding to the critical need in our community. If you look at all of the data for the past 10 months of this pandemic, Lane County has fared significantly better than the state and the national averages. Our public health professionals have worked round the clock for 10 months. You heard Dr. Ludke talk about the work that he does just with the University of Oregon on nights and weekends. And I can tell you that these folks have poured everything that they have personally and professionally, and they brought their best every single day. We talk about how aggressive we've been in our outreach and education work. And I will say that I've seen zero data to indicate statewide, nationally, or even internationally, to indicate a correlation between writing tickets for people who don't wear masks, which is what the suggestion is here, that we should have a local ordinance. We already have a statewide requirement for mask wearing. Our public health officials have said, if the board wishes to direct us to develop a local ordinance and to hire mask police, then we'll do that. But my view is that the board has not directed us to do that, because you've seen what we've seen, which is there's no correlation between writing tickets for not wearing masks and a reduction in the number of cases that we're going to see here locally. So our public health officials have been active and aggressive at making recommendations based on science and medicine to the board. And I guess my comments are just to say that I'm saddened by what I view as unproductive criticism of our hardworking public health officials who've been busting their tails behind the scenes with not a lot of, they haven't asked for anything, and they've come in every day for the last 10 months and been just working their tails off. So you can sense that I guess I'm a little defensive right now, and I'm doing this on my own accord because I just want to recognize the work that our folks have done and continue to do, and the professionalism and scientific-based recommendations that they continue to make to the board. And so I struggle with a criticism that our staff is either stuck or unwilling to change, when I think what they've been doing is at the leading edge of keeping our community safe. And Dr. Warren, with that, Dr. Ludke, you can certainly say anything else that you would like to in response.
I would add one thing, Chair Buck, Commissioner Sorensen. I think public health really does want to operate on science. But again, the first person who became ill with this in Lane County was 9 months ago today. We have learned a huge amount in those 9 months, but there's so much we don't know. And when I look at the knowledge that we have with measles and diphtheria and strep throat, we have so much more epidemiology and clinical data on these diseases we've been fighting for years. We only have 9 months of data, and we are not flying blind, but we certainly are not flying with all of the modern avionics that we wish we had.
I appreciate that very much. With that, I think we will end this particular item on our agenda and keep moving forward for today. I appreciate your time, and we'll probably see Karen next time, but you are welcome here anytime. Thank you. Commissioner Burney?
Yes, I will follow what the chair has guided. I want to thank Commissioner Sorensen for taking all my time. And I just want to say, Dr. Ludke, that I am a fan of your 3:30 p.m. every Friday afternoon on KLCC radio show. I have not called in because I thought I was going to get to ask my questions today, but hopefully soon. And thank you for that, very much for that. I think that's really informative for the community. Thanks for allowing me to say something, Chair.
Absolutely. And that's just a reminder to us all to make sure that we keep enough time for everybody to ask their questions. We'll move on to the consent calendar. Is there a motion to approve?
I move approval of the consent calendar.
Second.
Okay, moved by Commissioner Burney, second by Commissioner Sorensen. Any discussion? Seeing none, I'll call for the vote. All those in favor, please say aye.
Aye.
Aye. All those opposed say nay. Motion passes unanimously. We'll move on to item 7A, Order 20-12-01-06, in the matter of authorizing the sale of county-owned tax foreclosed property for $53,515 to Vern Benson and 5 Doves LLC owners of record for map numbers 17-04-26-12-07298, as well as 17-04-26-12-07299, and 17-04-16-32-13200. And with us is Jeff Turk, our property manager.
Good morning, Chair Buck, Commissioners. Again, as noted, the matter before you is consideration of a sale back to the former owners of record, Vern Benson and 5 Doves, which Mr. Benson is a principal of. There were 3 properties, 3 residential properties in Eugene that were foreclosed upon last September. The redemption period had expired, and Mr. Benson is requesting that they be sold back to him pursuant to the Lane Manual, which provides for selling a property, for the board to consider selling a property back to the former owner if there was a mental or physical incapacitation. He has supplied documentation, which was in the packet. So it's the board's decision as to whether to sell it back to him or not. The properties were residential properties in Eugene that were occupied by tenants. At the time, 2 of the properties are still occupied by tenants. The tenants moved out of one of the properties. So if there's, Mr. Benson, as he mentioned during the public comment, and when I spoke with him, when I had went to the properties, that he thought he had more time to redeem them. He does have other properties that are on the redemption list for 2021. He's had properties in the past that he has redeemed. And again, so it's the board, to decide whether the conditions of Lane Manual have been met and whether they want to sell the property back to him. And I can answer any questions the board may have.
Thank you. Any questions or comments by commissioners? I'll just add that after review of the information that was presented, this seems to be a ever revolving issue for this particular owner. There looks to be a number of properties that are either now foreclosed or in the process of or redeemed previously. I'll just make a note that I think that this is a case where the owner needs to ensure that they employ somebody to carry on the business of managing these properties properly. So this is not a reoccurring issue, because it sounds like, from what I see, this could come up to our board again for different properties of the same owner. Is that correct, Mr. Turk?
Possibly. Again, as the documentation I provided in the packet shows, he's often had properties that have actually the judgment filed and in the redemption period over the years, which he has redeemed. So, and again, as it notes in the memo, he does have, I believe it was 8 properties that are currently in the redemption period that would expire in September 2021.
I'll also add that it looked from the material you offered that these 3 properties have a value of roughly $615,000.
Yes, that is what the assessor has, the market value of them.
Okay. And the price for redeeming or buying back, I should say, is currently in here $53,515. I'm reluctant to remove or not give the opportunity back for that much investment in property when there's a genuine health concern. My only caveat is if this continues for this owner to be returned to this board for reconsideration again, I would probably not be as gracious. Commissioner Farr.
Thank you, Chair Buck. I do agree with your concerns and your stated comments. To move the item forward, this item is in my district. I would like to make a motion. My motion is to authorize the sale of county-owned tax foreclosed property for $53,515 to Vern Benson and 5 Doves LLC, former owners of record, map number as stated in the motion at 17-3.
Is there a second?
Second.
Okay, moved by Commissioner Farr, second by Commissioner Bozovich. Discussion, I saw Commissioner Bernie's hand up.
Thank you. I was going to say, Jeff, Mr. Turk, is this, in reading through the material, would you call this a pattern of behavior?
Well, I'm not, you mean you're referring to the number of properties that Mr. Benson has had?
Yes.
Yeah, I think that, the data speaks for itself. You see on the, documents that I, provided in the memo that he's, had properties on, that have gone to judgment on a redemption list for, a number of years. And, he's always redeemed them, but he does appear to have properties that are always going to judgment and in the redemption period.
I believe in the public comment, his attorney, and he indicated that he both had mental health and operations, surgeries. Has that always been the case with all of these properties? Has this been an issue?
I can't speak to that because, again, he's redeemed the properties in this, and so they were never deeded to the county. In this instance, there were 3 of the properties that were deeded. There were 2 other properties that were also that got redeemed this past September, but these 3, did not. So I can't speak to the past as to, what caused them to go into judgment.
No, that's fine. I'm just trying to get a handle on it. That's all. I'm just going to ask a couple more questions. You may or may not be able to answer. Do we know how many properties, rental properties, Mr. Benson has?
No, I don't.
Well, because I thought I heard him say he had no money and he was going to have to borrow money from his children to redeem these properties. What I'm getting at is, I'll go along with the group on this, but what I'm getting at is, it sounds fishy. And it just seems as if this is not someone who doesn't have millions of dollars worth of properties. This is not someone who's facing huge financial hardship, which is what we were told. If we're going to make an exception, fine. But I just don't think we should get in the habit of making exceptions under these kinds of circumstances. Just my opinion. Thank you.
Commissioner Bozievich.
Thank you. So we are right now making a decision on 3 properties that that there's been exemption requested for redemption past the redemption period. And we have clear guidance in our lane manual about what qualifies for those exemptions. And the applicant for that has presented evidence that they meet those qualifications. Prior properties going in and out of foreclosure and being redeemed has nothing to do with this particular decision. And in fact, if we take that into account, I think we're setting ourselves up for some legal liabilities. Property owners have rights under state law, to redeem properties that go into tax foreclosure. And if they do it within the normal period, we have no say over how often they do it. And if they choose to that may just be a reflection of either the quality of renters that are occupying or a low vacancy rate. I don't know what's going on, disrepair of properties. There's 1,000 things could enter into why a landlord would allow their property to not pay the taxes. And that's not our business as commissioners, because that's all handled under state law. The ability to redeem a property that's gone into foreclosure and get within a time period. The only thing that's under our purview is to grant an exception if they miss a deadline. And we have some specific things about that exception, and I believe that the applicant has provided sufficient evidence. And the only thing, if it gets to the point where there is a continual request for exemptions, then we may have some issues there. But anything about other properties that have gone through foreclosure redemption processes within the time periods has absolutely nothing to do with this decision. So I would warn the board about being careful about trying to connect those dots until we see Mr. Benson come back maybe with another request to redeem a property post the exemption period, coming back with some other claim for a medical excuse or something, at that point, then that's something we could allow into that conversation, because we're seeing one here. I don't believe this is the only time I think he's missed the deadline and is asking for an exemption. Is that an accurate statement, Mr. Turk?
Actually, I believe it was 2016 where the county, a property that Mr. Benson owned, got deeded to the county, where when Mr. Benson again contacted the county afterwards, he again said he thought he had more time. This was a vacant lot in Eugene. So there was one a couple of years ago that had been deeded to the county.
Yeah. Did we grant the exception at that time based on medical?
He didn't request a sale back at that time. So it just remained in county inventory and was eventually sold at auction.
Okay, so it got sold at auction, and we did not deed it back for payment on the back taxes like we're getting ready to do with this, or at least the motion is.
No, he didn't request this process back then.
Okay. So he understood, he just missed the timeline then.
Yeah.
Thank you.
Okay, Commissioner Burney.
That's it. Do you hear some background somewhere?
Yeah. That might be Commissioner Farr.
Okay.
His thing's on.
Okay. No, I wasn't going to counter anything Commissioner Bozovich said. I appreciate the clarification. I also wasn't asking the board to make a decision based upon those sort of collateral things. I was thinking out loud. I should learn not to do that.
That's okay. Any other comments or discussion? So we do have a motion on the floor. All right. If not, we'll call for the vote. All those in favor, please say aye.
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 All those opposed, say nay.
Nay.
Okay, so I can't see if Commissioner Farr voted or not. Right now I see three ayes, one
I was
nay.
affirmative, yes vote.
Oh, there you are. Okay. We can't see you, but we can hear background noise. So that would be the 4-1 with Commissioner Burney and the nay. Motion passes. Thank you. We'll move on now to item 8, our sheriff's report, and the matter of inventory and use of equipment acquired through Law Enforcement Support Office 1033 program. I see the sheriff is with us.
Thank you very much, Chair Buck and Commissioners. I know you've had a really busy morning, but I appreciate the opportunity for us to give you some information about this program. This is a topic that comes up periodically, and I think it's really of great value for the commissioners to have this information and understand how this program has benefited Lane County, the Lane County Sheriff's Office through the years. I do have with us Lieutenant DJ Mann and Captain Chris Doyle. Both have been involved extensively in this program for quite a period of time, and so they're going to walk us through this presentation.
Chair Buck and commissioners, before Lieutenant Mann gets started on the presentation, I just want to provide a little bit of context to a phrase that you're going to hear throughout the presentation, and that's the term high risk. And you might hear it referred to as a high risk search warrant or a high risk call for service or a high risk incident. And when we determine whether something, what the risk level it is for law enforcement or citizens, we evaluate 3 basic factors, and that's first of all, the level of the crime being investigated. So obviously, if we're investigating homicide, that would be a higher risk than if somebody stole a candy bar from the store. A second factor that we look at is the criminal history of the suspect or their known associates. So if a suspect is on parole for homicide and they stole a candy bar from the store, and the store owner calls us and says, "Hey, this is the suspect, and I happen to know him, and I was at his house last week, and I also saw a gun there." Obviously, that would cause us, even though the crime is relatively minor, the circumstances, the report of a suspect being armed and dangerous to law enforcement or to citizens. Most of the time when we're evaluating a high risk incident or when we determine that something is high risk, it's a combination of more than one of those factors. Occasionally it will just be just one of those factors. But anyway, I just wanted to talk about that briefly before Lieutenant Mann gets started here, because we're going to use that phrase high risk frequently throughout the presentation. Thank you.
Bear with me while I get my screen set here. And the screen I want just disappeared. Probably going to need Carrie Carver to come over here and move this over here. Okay. Carrie, one more thing here. I want to see what they're seeing. I had to move the. Okay, there we go. But my notes disappeared.
We can see your screen
Okay.
on our end.
Okay, I think we're ready then. The 1033 program allows local law enforcement agencies to obtain unwanted military surplus equipment. The equipment has already been purchased by taxpayers and increases local law enforcement's capabilities, in addition to improving safety of community members and first responders. The National Defense Authorization Act of '97 allowed transfer of excess Department of Defense equipment that might otherwise be destroyed to law enforcement agencies across the United States. Since this program started, there's been over $7.4 billion worth of property allocated to participating law enforcement agencies. At the Sheriff's Office here, the property includes everything from clothing to a couple of hospital beds for the Lane County Jail, as well as office equipment and tactical vehicles. Of all the equipment provided through the program nationally, only 5% are small arms and less than 1% are tactical vehicles. And there's more than 8,000 law enforcement agencies that have enrolled in this program. As you listen to this presentation, I'd like you to occasionally think about the images of this slide. In 1997, 2 bank robbers fired 1,100 rounds during a 44-minute gunfight in North Hollywood. The initial patrol weapons did not defeat the body armor worn by the gunman, resulting in police firing hundreds of rounds while attempting to stop the gunman. A combination of 20 civilians and officers were wounded. An armored bank car was commandeered to rescue civilians and officers pinned down by gunfire. Officers actually went into a nearby gun store and obtained rifles that could defeat the body armor of the gunman. This call demonstrates a dire situation in which law enforcement didn't have the equipment necessary to respond efficiently. This call changed how modern law enforcement prepares for this type of event. The Sheriff's Office has been using surplus military equipment for over 30 years. Prior to the 1033 program, LCSO took possession of 2 Vietnam-era helicopters that were used by the Sheriff's Office for many years before they were taken out of service due to their age. Oversight. Law enforcement agencies must demonstrate a need for the equipment as part of the request. All requisitions of property must be approved by Oregon Surplus Property Coordinator. The Law Enforcement Support Office then screens approved requests. Our state coordinator has commended the Lane County Sheriff's Office for the way in which we have participated in the program. He often refers other agencies to us for guidance when they first start using the program. Responsible use of the 1033 equipment. Property requests. LCSO command staff must approve all requests of 1033 equipment. Requests then go to the Oregon State Coordinator and LASO program. A property that's obtained in this program is regularly inventoried and kept track of. The next slides will show some of the equipment LCSO has obtained through the 1033 program. LCSO has received surplus rifles. Once obtained, these rifles are converted from full automatic to semi-automatic only fire, which is the same configuration available for sale and use by the general public. They are AR-15 rifles, a standard long gun in American law enforcement. LCSO would purchase and issue these rifles to our deputies regardless if they were available at no cost through the 1033 program. Rifles allow for much greater accuracy at longer distances than a handgun or a shotgun. They're also easier to shoot by deputies of all sizes due to their low recoil. The rifles are only taken out of the patrol vehicle when there is an elevated threat and reason to carry them.
And, Chair Buck and Commissioners, if I could just comment on that briefly, just I think you guys probably already know this, but those rifles are only taken out on high-risk calls, and they're certainly not out on, our deputies are not taking them out on regular calls for service or traffic stops, or you're not going to see a deputy with a rifle in their hand on things like that. It's just reserved for high-risk calls.
These are some of the items on the inventory. You're going to see infrared illuminator. It's a laser aiming device. They're used on lethal and non-lethal weapons to improve situational awareness and increase accuracy. They are compatible with night vision and work in a variety of lighting conditions. The special response team trains and uses these devices so that visible light can be minimized during exceptionally dangerous calls. You can't safely search with a common flashlight when the person you're looking for is likely to shoot at you or the light from your flashlight. We currently have a couple versions of this device. The one pictured retails for around $2,000, and we obtained a lot of 20 of those that were in brand new condition through this program. This rifle scope retails for nearly $3,000 and performs exceptionally well under a variety of different conditions. Most law enforcement agencies don't issue this kind of high quality rifle optic because they're just too expensive. This particular one pictured was a batch of sticks that were all brand new, and all we had to pay for was the shipping. Precision optics reduce liability. If a deputy is forced to shoot, we want that deputy to be accurate because they're responsible for every round that is fired. Every patrol deputy is issued a patrol rifle. Every patrol rifle is fitted with a high quality optic, and most of our optics were obtained through the 1033 program. The 1033 program titles this large tent an improved combat shelter. We've just called it a big tent. LCSO can set up a command post or shelter in a remote location when a building is not available. We received 2 of these particular tents and have them ready to set up when needed. The pictures show our search and rescue members setting up the tent and then using it for a classroom during training. The armored rescue vehicles. These vehicles are used during responses to calls involving threats of gunfire or when planned search warrants is determined to have a substantial risk to those tasked with serving the warrant. It would cost well over $1 million to purchase comparable commercially available vehicles. When obtained, one of these vehicles had less than 200 miles and the other had around 400 miles on it. They'd been sitting they're probably 9 or 10 years old. They've been sitting out on a base somewhere, but they were mechanically sound. LCSO used drug forfeiture funds to refurbish and outfit them for their new law enforcement mission. Patrol cars do not stop bullets. No vehicle is guaranteed to stop bullets, but an armored rescue vehicle has the best chance of keeping people safe from gunfire. These vehicles can be used to shield neighboring residences and safely evacuate people out of a dangerous location. LCSO armored vehicle use. There must be a valid reason for taking one of these out. Command staff is advised whenever an armored rescue vehicle is going to be driven, including for training and routine maintenance. Vehicles are only used on high-risk calls involving weapons or other known threats to first responders or the community. Once a scene is made safe, the vehicles are returned to storage. Armored rescue vehicles have not been used during civil disturbances or protests by our jurisdiction. The only time one of these vehicles would show up at such an event would be when the event was under attack of an active shooter, and that vehicle was needed to rescue or stop the active threat. LCSO had armored rescue vehicles for the last 30 years. The first vehicle was a bank transport truck that had limited ballistic capabilities and no off-road capabilities. It's the same as that vehicle that was commandeered basically in North Hollywood. The Lane County Sheriff's Office used these vehicles in a responsible and judicious manner.
One thing that comment about that is that Lieutenant Mann was talking about the commandeer, a bank truck that we used to have, and that armored vehicle was only capable of stopping handgun fire. It wasn't capable of stopping rifle fire. And that's a significant difference between these armored rescue vehicles, is that they'll not only stop threats from handguns, but also from rifles, which is it's just a huge officer safety deal for us and for the citizens that when we take these out.
On the inventory, these are going to show up as unmanned vehicles. It's a small robotic camera. Whenever possible, we use these to look in dangerous places, which is safer than sending a deputy into harm's way. The Sheriff's Office would not be able to afford these safety tools without the 1033 program. Example, the robot on the right, those are 30 grand, $30,000 new. We got 3 of them in one delivery, and they were in that condition. They were basically new, unused. LCSO purchased, it's called a Throwbot years ago. That's the one on the left. It's about a $14,000 item. Weighs about a pound. I mean, this thing, you can hold it in the palm of your hand. Since then, we received 5 in really good condition on the program. And we use these to take a look without jeopardizing the deputy, to gain better understanding of what you're dealing with. Often, we don't know if the suspect is inside, is alive, or what level of resistance will be presented on some of these calls. Having several of these devices allows us to issue them to deputies out on patrol, so they're out with the deputies and available to be used in a moment's notice. An example of I can give you is we had a report of an armed subject inside the I-5 rest area. We're helping out the state police with this call. The complainant heard what they believed was the person cycling a firearm in the stall. So the robot was used to get in. We put the robot into the restroom so we could get a look at what we were dealing with before we just called this person out into the public area. Later, I'm going to talk about a call where the robot was introduced into a garage and the suspect immediately started shooting. What would have happened if the deputies didn't have the robot and had to enter to take a look?
Yeah, and I'd just like to comment, just to reiterate that with these robots, it's really changed the way we do business for the better, and it just prevents some of those face-to-face contacts with a dangerous and determined suspect that would. I mean, that's when both suspects and deputies get hurt, is during those face-to-face contacts, and when we are able to use these robots to see where somebody's at. And it just is a huge safety factor for everybody involved.
So robots really keep everyone safer. Here's a typical scenario of clearing a building that might have a threat inside. We want to get the robot in to look around first. If no threats are observed, the canine is sent in. If the canine doesn't alert, the deputies will eventually enter to confirm the space is clear of threats before we turn the residents over to a victim, or it just depends on the situation. This is an example of us using de-escalation tactics designed to prevent a sudden close quarter use of force situation between deputies and a suspect. It's better for the deputy to locate the suspect on the camera feed and evaluate the situation before entering and potentially being ambushed or forced into a deadly force situation. Okay. The top or the left photo is a small handheld thermal imaging device, and these retail for around $11,000. We received that particular device came in a box of 12 at no cost. Besides the obvious safety factor, these devices greatly increase efficiency of finding a person. We routinely use a handheld thermal imager while using our canines to track suspects in the woods, so that we have a better chance of spotting the suspect at a distance where we can make a plan and not have that close face-to-face chance of use of force. If you look at the picture to the right, it just shows this, even in the daytime, there's a person standing there in both pictures. You just can't make them out in the foliage, but on the right, it shows how the thermal imager picks up the heat signature and shows that difference compared to the surroundings. Night vision is different than thermal imaging. Night vision can give you a false sense of security in some settings. So on the left, it shows there's a person in both those pictures. Night vision just amplifies existing light compared to on the right, the thermal imaging showing the differences in heat that make live people stand out very obviously. Most law enforcement agencies are lucky to have even a few sets of night vision available for their officers to use. Because of the 1033 program, LCSO has several handhelds and even some vehicle-mounted FLIR devices available. Unfortunately, most night vision is destroyed by the military to some degree before it is made available to us due to their DMIL requirements. You don't really know the condition of these items until they arrive. Pictured as a $12,000 set of night vision that luckily just need a fresh set of batteries. We have repaired some night vision devices for a fraction of the cost of buying a complete unit. This clip will show the difference between a normal camera view and a thermal imaging camera. As you can play this for you. As you can see, the thermal camera shows surface temperature. Contrary to the movies, thermal doesn't see through structures. It will not even see through a window. It just shows the window's surface temperature difference compared to the surrounding settings. On this call, patrol has been hailing for the occupants to exit the residence. The occupants only complied when the armored rescue vehicle arrived at the location. Upon seeing the vehicle, the occupants realized we weren't going away and decided to exit without incident, which is typically how the vast majority of these situations are resolved. Oops, you're gonna see it again here. What this equipment does for Lane County, it increases safety of our staff responding to high-risk calls for service. It gives us increased options for resolving dangerous calls safely. Sometimes you need to get close in order to communicate and see what's going on. Armor allows this. Increased capabilities. One deputy with a thermal imager can scan a large area for a child that may have wandered out and has gone missing. You think about sending deputies into a wooded area at night to search for an armed suspect. This is very dangerous work, and the deputies need special equipment to increase their safety. The 1033 equipment improves de-escalation opportunities by providing the tools to minimize face-to-face deadly force confrontations. Ballistic protection of an armored rescue vehicle allows responders to get close enough to communicate and understand what's going on. You need to be close enough that you can hear what the person inside is trying to tell you if you're going to establish communication and negotiate. They won't always pick up the phone and talk to you. Increased options. With armor, you can go slow and controlled versus relying on surprise. 20 years ago, the standard way to serve a high-risk search warrant was to arrive at the front door unseen, announce as you forced entry with the intent of flooding the structure and quelling any resistance basically by surprise before somebody could arm themselves and fight. So it was a reliance on surprise. The way we do things now with slow and controlled with armor is a much better way of doing business and minimizes those face-to-face encounters. Time and distance when using electronics to locate and evaluate from a safe vantage point while searching. This is a big one, information gathering for an improved plan to resolve the situation. You can put one of those camera robots in and you're going to know a lot more about what you're dealing with and can improve your plan. LCSO strives to use this equipment in a way that helps keep everyone safer. We typically are able to resolve serious incidents without physical force even being used. Okay, what happens when we no longer need the items we've gotten from the military? Controlled items must be returned back to the military. Items that are not required to be turned back in, generally office supplies, clothing, disposable type equipment, can be donated. In June of 19, the Sheriff's Office returned numerous items that we couldn't fix, were obsolete, or just not needed anymore. The picture on the right is a Eugene Weekly article showing Sheriff Trapp donating cold weather clothing to help our local unhoused. Controlled property, like tactical vehicles, has more restrictive requirements for disposal. Most controlled property must be returned to the military when no longer needed. The photo on the left is an unarmored Humvee that was used in Marcola during flooding. That Humvee is now on loan to the Lane County Emergency Management. The Humvee on the right was transferred from LCSO to the Florence Police Department when we obtained a more capable model of Humvee. An additional Humvee was also transferred to the Cottage Grove Police Department. These transfers allow our smaller cities to be more prepared for events in their jurisdiction. The transfers were approved through the Oregon State Property Coordinator and the LESO program. We do not hide our armored rescue vehicles from the public. For many years, LCSO has enjoyed bringing them out to various events and interacting with the community. Every year, Janet Whitty from the Peterson Barn Group invites LCSO to this family-friendly event, as the armored rescue vehicle is a favorite stop. Kids and adults are allowed to go into the vehicles and explore them as they take pictures and chat with the deputies. And the line is like that until everybody's been in it and seen the vehicle.
And I think I can speak for Lieutenant Mann on this as well, that the first couple of times that we went out to one of those community events like that, we were nervous that we were going to get complaints, just because when the 1033 program first started getting some notice back when the Ferguson incident was happening, is that we told that people were going to be upset by it, but that was not our finding at all. By far and away, most people were excited about the piece of equipment. They were happy that we had it for our safety, and the few that did have questions about it, once we got a chance to actually explain why we use it, when we use it, the safeguards that are in place before we use it, they left with a different understanding, and there were just very few people that were upset by it.
This is actually out at the Veneta Harvest Festival. That every year we do that. There's several events that we like to do every year, but unfortunately, because of COVID, we haven't been able to participate as much in these kind of events. I've had the opportunity over the years to speak with hundreds of community members at these kinds of events. The interactions are overwhelmingly positive, and it's very rare to have someone flat out say that we shouldn't have this equipment. I personally recall only 2 of these encounters, and basically they said that to me as they were walking away and didn't want to engage in a conversation. Occasionally, sincere questions like, why do you have these, or have you ever used them are asked. This is a great opportunity to have a conversation about the kinds of calls deputies occasionally handle and how these vehicles are used. The typical response is that the community member never knew things like that happened in our area, or they had never thought about how we would safely resolve that kind of situation. Again, the conversations are almost always positive. These photos show heavy snow and downed trees in the McGowan Creek area. Humvees are very off-road capable and save our patrol vehicles from being damaged in extreme conditions. With the benefit of the 1033 program, LCSO has special equipment and capabilities that some smaller agencies do not have. We routinely provide assistance to our neighboring agencies. The photo on the left shows LCSO assisting the Florence Police Department with serving a couple of search warrants. The photo on the right shows LCSO working with the Cottage Grove Police Department. And I should add that it's not just the vehicles we assist with. There are lots of occasions when they want a deputy there with a thermal imager or the remote camera to take a look at something. Very frequent that we help them out. A Bearcat is a commercially available armored rescue vehicle that is used by many law enforcement agencies across the United States. LCSO would love to have a new, reliable armored vehicle, but when you consider the price, it makes more sense for us to continue using vehicles that obtained at no cost through the 1033 program. The money saved can be used for other needs of the Lane County Sheriff's Office. Without the 1033 program, LCSO would have to expend around $750,000 to $1 million in order to purchase and outfit commercially available armored rescue vehicles. This huge expense would be required in order to continue responding to dangerous calls for service in rural Lane County while still practicing modern law enforcement best practices. This slide demonstrates that military vehicles offer greater ground clearance and increased off-road capabilities. In this picture, another agency's Bearcat became stuck in the driveway during a search warrant service. Our surplus armored rescue vehicle was used to pull it free. It's very common to encounter difficult terrain in rural Lane County, and military surplus vehicles are designed for these conditions. Rural Lane County properties occasionally have lots of vehicles, outbuildings, and general clutter, which complicate police response in some situations. There are many places for a threat to hide on a cluttered rural property. Rural properties are often in the wooded areas that present additional challenges. Having 360 degrees of cover from an armored rescue vehicle helps keep first responders safe while securing a difficult scene.
We have this slide just in place just to help the commissioners understand why we have more than one armored rescue vehicle. Is that we oftentimes run into these, I'll call them a compound out in the rural Lane County where there's multiple people in everything from travel trailers to other little shacks and structures. And because we have more than one armored rescue vehicle, we are able to cover those multiple, I'll describe them as a threat when we're out on a call like that from the safety of armor. And in addition to that, even if there's only one structure or residence, it allows us to have a better containment where we can use the protection of armor to cover both the front and the back while we're continuing to hail to try to get voluntary compliance.
I want to talk about a recent difficult call in rural Lane County. This started out as a routine complaint that someone had threatened utility workers. No weapon was seen or known to be involved. Deputies made contact with an occupant of the residence, and were directed to a garage to contact the involved individual. This is what happened when the deputies knocked on the door to speak with the involved.
people too. If there was use a long gun, we didn't have eyes on it. It's shooting from inside the garage.
The deputies had been ambushed by a gunman concealed inside the residence. Numerous rounds ripped through the door and wall where the deputies were standing. The special response team was called out and armored rescue vehicles were immediately routed. Occupants were evacuated from the involved residence by deputies on scene. The armor arrived and provided cover at the difficult location that otherwise provided no real cover. Attempts to communicate were not responded to. It was unknown exactly where the suspect was or what he was doing. A small robot was deployed in the garage to remotely look inside to attempt to locate the suspect. The suspect began firing what would be another 60 or so rifle rounds. Armored rescue vehicles were struck by gunfire and bullet fragments. Armor stopped multiple bullets from possibly striking neighboring homes, and of course our deputies. Tear gas was introduced and the suspect surrendered. It was a miracle that nobody had been injured or killed from gunfire on this call. Multiple 1033 assets, including robots, rifles, and armored rescue vehicles were used in this response. The red tape indicates damage from bullets and fragments of the bullets that struck the vehicles. Where would these rounds and fragments have ended up if not stopped by the armored rescue vehicles? This metal brake component from the front of the armored rescue vehicle didn't survive the shooting. The hole you're seeing is actually the exit, so it came in from the other side and went right through this metal canister. This metal canister is constructed similarly to our patrol cars as opposed to the armored steel on the armored rescue vehicle. Look at the damage done to this thick steel by the bullet. The bullet strike sent fragments of metal flying through the air. Any of them could result in a potential fatal injury if they struck a person in a vital area. If you look closely in this picture, you can see the operator sitting behind the window of this vehicle. Over 100 high-powered rifle rounds were fired by the suspect at this call. How do you respond to this call without an armored rescue vehicle? The suspect was taken into custody on this particular call without injury. The tear gas deployed from behind the cover of the armored rescue vehicles de-escalated the situation, and he was taken into custody without any injury. Okay, this is the last slide. The Sheriff's Office responds to dangerous calls for service on a regular basis. Far too many of our deputies have been shot at or threatened with deadly force during their service, some of them on multiple occasions. Just 5 years ago, Deputy Todd Olson was seriously wounded when deputies were ambushed in rural Lane County. That gunman fled into the woods near other residences and resulted in an extremely dangerous search taking several hours before the suspect was located and taken into custody. A lot of equipment from the 1033 program was used during that response and search. Imagine walking in the woods with a flashlight looking for this armed suspect. The most recent call in which deputies were shot at was 2 months ago. Armored rescue vehicles have been routed to several other calls for service since that recent incident. And one of those calls, a convicted felon fired a weapon inside his home while threatening a family member. That subject barricaded and eventually was taken into custody by deputies using Program 1033 resources. Approximately 67 firearms were recovered. Some were stolen, and one was fitted with a thermal imaging rifle scope. It should be noted that subject was also taken into custody without any injury. The Sheriff's Office responds to dangerous calls for service on a regular basis. Thank you for the opportunity to speak about this program, which is vital to the Lane County Sheriff's Office and the services that we provide to our community.
Yes, thank you, Commissioners. We really do appreciate the time you've given us, and we're going to ask for just a little bit more I wanted to highlight just a couple of things that you already heard from Lieutenant Mann, but particularly he mentioned the tactics 20 years ago. So in 1999, I had the privilege after a selection process of being accepted onto the SWAT team. And within a fairly short period of time, I found myself as what we called the point guy on the entry team. That meant I was the first one to go through a door. And as Lieutenant Mann was explaining, when we didn't have these armored vehicles, we used the element of surprise instead to try and keep ourselves safe. And if you think about the anxiety of approaching the door of a residence, obviously you already have been given a briefing that there's some threat factors or you wouldn't be there as a SWAT team. And the idea is that you're going to try and enter the house before somebody has a chance to arm themselves and create a plan. Just the amount of anxiety and the risk that goes into all of that. Now that we have armored rescue vehicles, we can pull into a driveway, be safe inside that armor, get on the PA or have a crisis negotiator make a phone call and say, hey, we're out here, we can't go away, you need to come on out. I can't emphasize how much safer and better this approach is. And it's not hard to do a Google search and find how what used to be called a dynamic entry for a SWAT team can go wrong. And now we have the ability to not do them that way. And so I think that's just a really important point. And I have personal experience with that. Speaking of personal experience, I responded to the hospital in September of 2015 when Deputy Todd Olson was shot. Lieutenant Mann and Captain Doyle both responded to the scene and spent hours trying to locate the man who shot Todd. I sat at the hospital with his wife and others who arrived. More recently, the October incident that you heard about, I stood at the command post with Lieutenant Mann and Captain Doyle as we heard this individual continue to fire rounds at our folks. And I can't imagine asking folks to go out and deal with these situations and not providing them the appropriate equipment to do so as safely as possible. I asked DJ and Chris to prepare this presentation as a backup plan. We were also working with Metro TV to create a video similar to the Holiday Farm Fire video. And I hope, commissioners, that you've all had a chance to see the Holiday Farm Fire video that we did. We created one similar to that on this Butler Road incident that happened in October. And so we'd like to show that to you now and then be available for any questions you might have.
Occasionally somebody will walk up at one of those public displays and go, have you guys ever had to use this?
We're going to be at a possible suspect of this.
And it's a sincere question, and then we'll explain the last time we've used it or...
For there too, that plate is returned to an address on Butler Road.
Copy, I believe the RO is the uncooperative one we're dealing with.
Maybe one of the real traumatic times we've used it and...
Shots fired!
Shots fired, shots fired. Copy, good to response, shots fired.
They just didn't know that we faced those kind of things.
Shots fired! Shots fired! Shots fired!
Shots fired one.
Go to your response! Shots fired!
Well, I want to take care of the folks I work with at the Sheriff's Office. I want them to have the tools they need to succeed, be efficient, and most importantly, be safe at their job.
Coming from inside the garage downstairs at the 24 Shots coming from inside the garage.
37 en route, en route.
Super important to me that they're safe and they go home in one piece. And this 1033 program has greatly improved our capabilities and raised the bar on our safety.
Myself and another deputy were dispatched to a call of a dispute in rural Lane County for a dispute between a male and another male who was a construction worker. And the foreman told us that a gentleman drove out of a address that he believed he lived at, drove down to them and told him that if they didn't stop, that he was going to come back and shoot him. And then he addressed every single employee that was working that day, telling them the same thing, asking who the boss was, and that he was going to come back and shoot him with his rifle.
And at that point, we determined to make contact with him to decide what really had been going on. No rifles had been seen. It had been verbal threats at that point.
The other deputy tried to make landline contact with the complainant first before we went out there. It went to voicemail, so we decided to go out there to make contact with them. It's a dense population of houses that are next to each other that would appear like the city, but it's out in rural Lane County.
They discovered that it was a care facility, and there was possibly a male living underneath the house in a kind of a lower story garage.
And so myself and two other deputies walked down to the lower half of the house and attempted to make suspect contact.
Somewhere around 2 or 3 rounds of knocking and announcing ourselves, we're at the point we don't think he's home. I advised Deputy Conway to be really stern and loud with this last round of knocking to make sure he knows we're there before we leave. Deputy Conway began to knock very aggressively on the door and yell for the subject that we needed to talk to him from the Lane County Sheriff's Office. Then all hell broke loose. I heard what I yelled in the radio to be 25 to 40 rounds from a major capacity rifle coming through the walls.
We didn't know where it was coming from.
I spun, there was nowhere to go.
But it was extremely close and sounded like it was coming from inside the garage.
Behind Deputy Conway was a sheer drop-off facing the door that the rounds were coming out.
You could hear them impacting with trees around us.
To my left and over to Deputy Campbell was a thin sheet metal garage door.
Myself and 2 other coworkers took off running.
There's just nowhere to be with rifle rounds coming out.
You could hear them as they were going past you.
And we just ran.
And got back to our vehicles, and called for code 3 cover, and that we had been shot at.
I didn't know it at the time, but the first 10 to 12-ish maybe went through the door that Deputy Conway is beating on. The next volley comes out that garage door in rough proximity where I'd been standing. So me turning and running, I had just beat that transition from one door to the next.
And these bullets, this high-powered rifle, it will rip right through your car. Unless you're behind armor, you have a good chance of getting seriously wounded or killed. So pretty good volley of rounds. I mean, I don't know how many. I've heard that it's somewhere over 100 in the total event were fired by suspect.
The first driving piece of armor, it went down that driveway to the lower garage so we could get something very close, a piece of armor that's designed to absorb gunfire, and that's what we needed, and the ability to loud hail on an overhead speaker. These are big bullet-absorbing sponges that we can get behind and into something peaceful. And the second piece of armor arrived, that's the Rook. It's track-driven, and I could hear it coming down the streets.
The doorway right up in front of me, you can see holes start poking through. And so I realized at that point that we're taking rounds and he's shooting at us again. You just continually hear gunfire, and then every little bit you'll hear things hitting and pounding off the Rook and the armor and stuff. So these vehicles do a lot of different stuff for us. It allows us to stay safe, but it also allows us to be able to keep the suspect safe as well, by being able to roll up in an armor, something big and bulky. A lot of them make a conscious decision that, yep, this is probably not going to end well, so they just come out on their own. I was getting ready to drive into the building itself, into the garage, to go find him and see where he was at and get him to stop what he was doing. At that point, he actually comes walking out.
He basically came out hands first. The first time we saw him, he's hands up and surrendering.
The goal of any incident like this is to apprehend a subject uninjured, to take the deputies home uninjured, and to resolve it peacefully. What we saw here was the absolute best use of armor.
The 1033 surplus program makes equipment that the military no longer needs available to us at no cost at the Sheriff's Office. The equipment is typically really expensive. The handheld thermal imagers that we have riding around with patrol and some of the night vision devices, these devices start at $10,000 or $15,000 often. The vehicles start at $500,000. We just wouldn't have that equipment. And those resources are critical to our well-being. I truly believe that. And I can't help but think that they've saved some lives along the way, our access to this equipment.
He walked out uninjured. Absolutely nobody, suspect, first driving deputies, or late arriving armor, nobody was struck with gunfire. It's a blessing.
Some people see these rigs and they're like, wow, what's that for? Well, it's truly a life-saving tool. It's a barrier from bullets that allows us to work other tools to resolve situations.
We don't bring them out all the time. They're not out on every single call. We don't run around and patrol with them and stuff. They just come out on certain circumstances when we feel we need that added level of security.
Standing in that driveway from me to you with a gunfire from an SKS, which is an old Soviet battle rifle that would probably go right through my armor that I wear. I wished I'd had a piece of armor right there with me. Wouldn't have had to run so fast.
Looks like we may have had some issues with sound. I'll certainly try and make sure that I get the link to that video out to you commissioners as soon as possible. And with that, I think we're happy to take any questions.
Thank you so much. I heard all the sound on that one, but not the original clip. Thank you for the video. Any questions or comments from commissioners? Commissioner Sorensen. Need your audio.
Thank you. Thank you so much. Well, first of all, I just want to say the video and the presentation were excellent, and I really appreciate the county's use of the program, particularly for all the equipment that was mentioned that have a life-saving component to them, both for the perpetrators or people that we have to encounter in this dangerous work, as well as the protection of the officers. My only real question has to do with the use of the larger vehicles in the civil disturbance area. And I'm wondering, Sheriff, if you have looked at any guidance from other law enforcement agencies where the civilian oversight is concerned about the use of those vehicles to put down lawful protests and otherwise intrude on the public's right to assemble and have political protest. Obviously, we need to make sure that people are safe, and we need to make sure that officers are safe. And I'm wondering if there's any models out there that you're aware of on how to address the concern of the use of these vehicles to suppress legitimate political speech. Is there any way to learn from other communities, or do you have any observations on this topic?
Yeah, sure. I'll just say that it's in our policy that we wouldn't use these vehicles related to any public disorder, but as Lieutenant Mann mentioned, it might be something that we have staged somewhere in the event that a situation turns into an issue with an armed subject. And so across the nation, I think everybody's aware there's been plenty of opportunities where folks have gotten together, they're using their free speech rights, and there's concern that some of them are armed. And there's concern that there might be a dispute between two opposing views, and there are folks who are armed. And there are circumstances where, obviously in our country, where folks use firearms inappropriately against a crowd. And so in our policy and in our experience, and what we have done is make a plan that perhaps the vehicle is parked in a place that's out of view, but it's available in the event that we have some sort of that type of emergency where we need to use it to shield people from someone, an active shooter, or someone who is inappropriately using a firearm. But yes, we have specifically addressed in policy here at the Sheriff's Office and certainly in practice that these vehicles wouldn't be used related to crowd control.
Thank you.
Any other comments or questions? Commissioner Brozovich?
I just want to thank the sheriff and everyone at LCSO for the presentation. And I truly appreciate the use of this 1033 equipment. Of course, I'm only a few miles from Butler. And I remember that incident and how it blew up on social media here out at my house. But I'm also just a few miles from Swamp Creek Farm, which I think maybe one of those compound photos might have been from. And it was where the sheriff successfully served a search warrant with no incident to a compound that has multiple shacks, tents, people living in RVs, etc. And ended up, was serving a warrant, I believe, for suspected felon in possession of a firearm. I think they confiscated something like 17 different firearms, including a loaded firearm without the safety on that was where a child was sleeping. And all this was done with absolutely no incident because they pulled up in that armored vehicle, announced themselves over the loudspeaker, and waited for people to come out peacefully. And the deputies were never in a situation where they had to decide, was there enough of a threat that they had to use deadly force to defend themselves? We've seen that situation just yesterday occur where law enforcement ran into an alley and was confronted by somebody attempting to injure them and had to decide to use deadly force, right here in Eugene. And we've seen those kinds of decisions have to get made in serving search warrants in the Breonna Taylor case. This equipment allows our deputies to keep the suspects safe. And particularly when you start talking about, that interaction between mental health issues versus criminal justice issues, quite often these issues are about somebody that is having a mental breakdown, and they really don't deserve to have to face deadly force decisions. And the ability to sit inside an armored vehicle or to have a remote camera come in and figure out the situation quite often is the difference between that need for that decision or not. And it keeps both the law enforcement safe and it keeps the citizens safe that we're responding to. And I really appreciate the change in how we're dealing with these situations, thanks to the equipment we're getting through the 1033 program. So thank you very much for that. And I really appreciate it, knowing those two situations just very close by and in recent history here out in West Lane County.
Commissioner Farr.
Thank you, Chair Buck, and thank you, Sheriff, Captain, and Lieutenant, for the presentation you just made. It was in no small part in response to a request made by Lane County's Equity and Access Advisory Board, which you don't report to, but you're providing this as a response to them as well as a response to the Board of County Commissioners. Thanks for the thorough report. I will tell you that the Equity and Access Board meets on Wednesday of this week, and I've been asked to be a panelist in that meeting, and I will be there at that meeting, and I'll let you know any questions they may have that go beyond the report. But thanks for what is, I view as a very thorough report.
Commissioner Burney.
I'm going to echo the appreciation for both the report and Lane County your office being beneficiary of resources needed for safety for everyone. I'd like to just follow the money for a moment, though. How is there a guesstimate as to the value in any period of time, a few years, as long as this program's been in existence, the value to the county in resources received for no cost?
it's for sure millions. I don't know if Lieutenant or Captain, you want to throw something out, but if you go all the way back to when I was still an Explorer Scout and we had a helicopter that was given from the federal government through this same methodology. And boy, if you think about what helicopters cost in today's dollars, we know for certain that these larger vehicles that you've seen, you know, those are $500,000 each probably. And then, you know, over time, being able to take a vehicle that's only got 400 miles on it, or take one of these high-end optical devices that are brand new in a box, they just need a battery, and the military was going to throw them away or destroy them. I'm real confident saying it's over $1 million, but we probably don't have a really good total calculation.
No, that's fine, Sheriff. Do you have, so this program's been in existence quite a while. Is this how the military disposes of its surplus equipment?
It's one way. I'll let one of you other guys who's more familiar with the program respond.
I would say that it is just one way that they dispose of equipment that has a genuine law enforcement application. Certainly, we're not even eligible to receive things like a missile or something like that. So,
gotcha. Okay, thank you very much. Appreciate it.
The video is a really good way for the public to really understand what you all go through. It's just incredible what situations all of LSCO goes through on a daily basis. You just don't know what call you're going to get and what tools you need. I mean, just like a carpenter needs particular tools to do a particular type of job, I can clearly see that your department needs the same thing. And just reminds us what serious situations are out there every day. As another rural Lane County resident, I appreciate your service and definitely appreciate the presentation. I have to tell you, I didn't know that this program existed for you to get this equipment until it was brought up earlier to add it to a presentation. So I'm really surprised that you're able to get the equipment at no cost, not even a, 50% off or something, but at no cost is pretty incredible, especially for the budget, the limited budget that you've had for so long. So thank you so much for the presentation. If we as commissioners have questions following this, we know where to find you.
Thank you so much, commissioners. Really appreciate it.
All right, we'll move on with our agenda to County Council announcements.
There are no specific announcements, Chair Buck, but I do want to remind the board that we have an exec session this afternoon, no time certain.
Good. County administration announcements. We did, seems like we did a few earlier, but if there's anything else.
Yeah, Chair, one of the things I was gonna do, which I've already done, is update you on Egan and winter strategies. So happy to answer any questions there. Mr. Rickoff also asked that I provide just an update for you, and Chair Buck, you may be able to add to this, but that we're working to join with other counties in advocating for a special legislative session to address the sunsetting of the eviction moratorium. So that is something that is on our plate and we're actively working on. So I'm happy to answer questions or if you want to share more about that. So that's what I have for you.
Okay. Commissioner Busbridge.
I just want to add that while you're advocating for that special session on the sunsetting of the evictions, which I think is probably a necessary thing, also it'd be great if they would deal with the 1 year to rebuild issue with that's a state issue on the land use. Try and get that extension for fire victims because that's going to take state legislative action, not something the county can waive.
Okay, anything else for this morning? All right. Well, with that, we are at recess until 1:30.